Recording.
All right. Okay. Good morning, everyone. Today is January 17th, and it is 9:03 a.m. in the year of 2025. This is the Contract Review Committee meeting for today, and I'd like to call this meeting to order. My name is Veronica Bolchik, and I am the chair. First thing I will do is establish a quorum, but before I do that, this meeting is being conducted in a hybrid fashion. So we are in the trailer room B and also on Zoom, so any vote needs to be done by roll call. So establishing quorum, as I look up on the screen, I see Sue Minthinen.
Present.
John Balash
Present.
and Joanna Roach.
Here.
Very good, and myself, so we have quorum. Can I have a motion to approve the agenda? Oh, I'm sorry. We also have some staff members here in person, Jericho.
In attendance.
And up on Zoom, we have Alexandra Richards.
I'm here.
Okay, and we will be having members of the public today who are doing presentations. What we will do is, as we get to a presentation, we will announce who is here. So but before we get to that, those should be starting at 9:15, and we have every 15 minutes for the morning, we have a different organization that will be doing a presentation for us and answering some questions. So approval of the agenda, please. Can I have a motion?
I saw Moses.
Okay,
Second.
got a second, Sue. All right, Sue,
Aye.
John,
Aye.
Joanna,
Aye.
and myself. Aye, so we have an approval of the minute, of the agenda. We don't have any minutes from last meeting, and I'm not sure if we need to be producing minutes for that.
We need to produce minutes for all of the meetings, but what we'll do is we'll just summarize sort of a bulk summary of the discussions and the points, if there's anything particularly important that comes up.
Okay, those will be forthcoming.
Yeah,
All right. And as far as public comment, I don't think we have any members of the public here that won't be doing a presentation, so we don't have any public comment. And we have a few minutes before we start our presentation, and we have a pretty busy schedule this morning. We have every 15 minutes up to 11:45, so we're gonna try to keep it to a no more than 10-minute just presentation by the applicant, and that will allow us a few minutes for questions. So we that's how we're gonna schedule this morning. If would it be appropriate that we could start the interview at this point? Because we do have Deb Dubois
I see no reason
waiting.
why we couldn't.
Okay,
I'm in shop. Okay.
alrighty,
Just as disclosure, I did reach out to Linda to see if she'll be attending. And then, other than that, no, I think we're entirely okay to do that. It's probably a good idea, actually.
okay, and so is Linda on her way?
I have not heard back from her as yet.
Okay. All right,
Madam
So-
Chair,
yes,
may I recuse, I am going to recuse myself for this particular applicant.
thank you very much, and we'll see you and hear you in at 9:30 then. All right, so first up, we have Deb Dubois from the Warming Place. So welcome, Deb, Happy New Year, and would you like to give us an overview of the warming place and your application.
Okay, great. Thanks for the opportunity to come. I was going to be in person, and then it took me longer to shovel out my car than I thought it was going to be. So I came back into the house. As all of you know, the Warming Place is the only overnight shelter on Nantucket. And this is our 4th season. So the following year would be our 5th season. Our statistics are pretty well outlined in our proposal. Last season, we served 22 individuals from 18 to 71 at the overnight shelter or during the day shelter. And it was a very diverse group in age and also in ethnicity. And just to give you an update, we have been open this year since November 1st. We haven't missed a night. Even during Christmas week, which was tough because there were a lot of staff and volunteers away, but we were open every night. We had dinner every night. So we're open from 6 to 7, 6 at night till 7 in the morning in 2 different churches. We were able to consolidate as we had hoped. So we're 3 days at the Congregational Church, 4 days at the Summer Street Church. Our day shelter is still open, and that's at the Summer Street Church as well. We have 70 volunteers this year, which I think is an increase. Last year we had 50 volunteers. So we continue to gain in people willing to help us, and also people know what we're doing. So that's very satisfying. We use volunteers in the beginning of the shelter to serve meals primarily, and also to spend the first 2 hours of the evening shelter in conversation with guests, because we really try to create a community. It's not just come in, eat, and go to bed. Also, it's gratifying this year, we have more Spanish speakers who are volunteering, which really helps because now about half of our population is Spanish speaking. So that enables them to, have a better sense of community. And it also helps us in what we're trying to do for case management. We're trying to understand what a particular person needs and then not duplicate services, but match them to other resources in the community. So the Social Services Department has sent folks over to meet with folks to ensure, excuse me, everybody who's qualified can get on Mass Health. Anybody who's qualified can get SNAP cards. Fair Winds also comes over to encourage people to take advantage of services there. And we also have Addiction Solutions is also willing to come over. And we have one success story this summer. One of our attendees that we've known for 3 years is working with Addiction Solutions, and he's been sober over 4 months now. So there are things, that happen in the shelter beyond just sheltering people. We often provide a bridge for folks. One of our guys just got a job at the, I call it the dump, but that's not really what everybody calls it. But he got a job there, which is very satisfying. He doesn't have housing yet, because, as you know, the availability of affordable housing is just really tough for some of these guys. We have a broad spectrum again. I would say almost half of the people are the working poor who just can't find a place. A couple guys either live in their van if they're not at the shelter, or sometimes they'll spend a late night at a site. We do allow people, if they're going to be late from work or church, to call us, and we do let people in if we know who they are and they've demonstrated that they're not out doing something they shouldn't be doing. So we try to be, as flexible as we can, but rules are very important. Our staff this year, we had 7 people come back from last year. We train them in CPR and first aid. And this year we got a grant from Remain to train people with an online training program by a fellow named Ryan Dowd, who has worked in homeless shelters for over 20 years. So he tells us, how to de-escalate situations, makes us familiar with different mental health issues, PTSD issues, alcohol issues. So we found that this is really good in not allowing situations to escalate. Some of the guys come in, and primarily it's been men this season, and they've had a very stressful day. So what we don't want to do is add to the stress. And sometimes, we need to, I don't want to say calm people down, but ensure that voices don't get raised and two guys get into it or they're yelling at the staff because they're unhappy with dinner. So it's a challenging role for both volunteers and staff, but everybody does a great job. The staff works an 11.5-hour shift. They come in at 7:30 and leave at 7. We have 2 people. That's our major expense is our staff, because that adds up very quickly. It's a specialized group of people who've often been a nursing assistant or work in the healthcare field, or we found people in hospitality are good too, because they work with people with a lot of different personalities and know how to get along with people, but also enforce rules, which is very important. So to date, we've had 24 unique people utilize the shelter. This week, I was away on vacation, but it was especially cold, and I understand there were 8 or 9 individuals every night staying overnight at the churches. We get our meals from a variety of places. We have the Brotherhood donates 1 meal, St. Paul's donates a meal, the Knights of Columbus cook a meal, and then the rest we have a relationship with one of the restaurants that stays open year-round on a very discounted rate to help us. So that's kind of it in general. We are going to, like we did last summer, we're going to extend our services over the summer and meet once a week and give out Stop and Shop gift cards, which we think is very helpful to get people still coming to see us, so we continue to refer them to services. Now, and I should say also the public health department, we had a nurse come and give COVID and flu vaccines a couple of weeks ago. So we really try to provide services in addition to what we consider to be life-saving overnight services. So that's it in a nutshell, and I'm glad to answer any questions you might have.
Deb, can you give a brief description of the grant and what you're asking for in your grant application?
Yes, this is the first year that we've actually applied. One thing that is different this year is we're now an independent organization, a 501c3. We had been working under the Interfaith Council before. So this year we've applied for $75,000 from the Contract Review Committee. And it would go into our general operating funds to support the shelter. If our fundraising goes very well, what we would use that for is to hire a operations manager and also to give our staff a 5% raise. They've been working 2 years without a raise. The operations has really been done by primarily almost all by volunteers, myself, and also Sue. We've been doing all the hiring, training, writing procedures, payroll, bookkeeping. And so we've been doing that now for 4 years. So if possible, we would like to work on the board, we are board members, and really spend our time really pushing the organization forward, because we have a vision of getting our own place, providing more services. If we don't get the money, we still have sufficient funds to operate, and we would just keep on going. So we believe that we're sustainable, but this would be a great help for us.
What I will do is I will open questions to the committee. John or Joanna?
Linda, I have joined as well.
And Linda also. I don't see any hands.
I do. I have some questions.
Okay, Joanna?
So let me just find my notes here. So this is the first year that you are your own 501c3.
That's right.
And you have all that paperwork is done and complete.
Oh, yes. We were very fortunate. We got a small grant to help us out to do that. And Brookmore turned us on to an organization, and we got our 501c within 4 weeks, which was like a world's record.
Yeah, it's pretty quick.
Yeah.
Okay. And then typically in the past, when we've given you funding as part of the larger organization that you previously were, I think, I don't know how it played out, but it seems like maybe you got $30,000 as a piece of that. Does that sound right?
That's right. We do it, your committee decided to divide it up
Yep.
by 3.
So this year's request, you're asking for $75,000, and it looks like it would serve around 50 people. I mean, I think that obviously I think this work is critically important and really important to the community, and 70 volunteers, especially any Spanish-speaking ones, is very impressive. But the question that I have here is, in the grant proposal, it talks about hiring an operations director and using some of the money for that. So can you talk about that?
Yes. As I was saying that we have a night manager, and what her job is to supervise the overnight staff. So all our employees are part-time seasonal folks. But the work doesn't end when the season ends. We spend a lot of time getting ready for the season, also managing our weekly outreach program. So this person would be the person to organize us getting together with homeless one time a week, buying the Stop and Shop cards, getting volunteers to also be there. This person does all the other organization. We have a shower program that's going to start in a week. We have to work with the churches. We have to hire and take care of our staff. We have to do payroll. We do a lot of grocery shopping, so there's the bookkeeping around that and bookkeeping around all the grants that we do. Because even for the smallest grant, we have to do quarterly or yearly reports and keep demographics, et cetera. And right now, frankly, I do all that work. I would say, and this would be a part-time job, so it's not a director, it's an operations manager who would be a part-time person doing that work.
I think that it's, for the most part, these grants are meant to support like program costs. And so looking at this, I mean, there's no doubt certainly that you need this kind of support in your organization. But I think that really focusing on the pieces of what you do that are direct service is probably most important.
And that's fine. I mean, we'd be willing to spend the money to support our program in general.
Right, because if you think about this, then, in terms of how this becomes sustainable for you, right? Like you're going to have to raise money to support this position, right?
Correct.
Ongoing, right? So,
Right.
so I think that, I would want to see some more detail on how that's going to happen, right? That's just feedback.
Yeah, I guess what we had before, our annual appeal, this is our second one, we actually had our annual appeal was independent last year, but we had to start our own mail list. So I think we got around 50,000. This year, we already have 100,000 in our annual appeal. So that's very good. What we had been, our funding primarily before that was from a founding grant that we received of $250,000. That person, we don't believe this year is going to give us that kind of money, but he has committed to raise even more funds from his group of friends and colleagues. So we feel pretty good about getting that money. Hasn't let us down so far, but we don't have that in the bank. And I think I mentioned, or I didn't mention to you in this presentation, but this is just our second year of fundraising. In fact, it's our first year of really going out and get individual large contributions. And so we did hire a contract director of development because we know that we have to raise a lot of funds to be independent, but we're confident we'll be able to do that.
Okay, great, thanks.
Linda?
I didn't get the number. How many people are you servicing right now?
Right now, we've had 24.
Is that consistent throughout the year, or does it fluctuate?
No, it really fluctuates because people come and go. Like we've had one fellow, thank goodness, left the island and went back to Texas, for instance. We have another guy who's now living on the Cape. So they're different people, but they're 24 unique people we've seen since November 1st, since we opened for the last season, this season.
Do you foresee, and this is 7 days a week, correct?
Yes, and 7 overnights and 2 days in
Do
addition.
you try to help them find housing,
No,
permanent housing?
we
Do
don't.
you
we
give
don't
them the
do that.
resources? Do you tell them where to go to look for that kind of thing?
Absolutely. And we did have one person last year who's now at the Landmark. So, you know, we do have some successes, but we'd like to do more. You know, again, that's part of this, why it'd be helpful to have a positions of an operations manager, because right now it's all volunteers. So we do the best we can. And in our future, we want to provide that. We'd like to have, you know, a homeless, not a homeless person, but a person really looking to get people on list for homes, to be searching online for rooms. But, you know, we don't have that resource at this time.
Okay, thank you.
I have one question. The training that you have a grant from Remain for your staff, does that training get extended to volunteers?
Yes, they have because it's online, the price is very reasonable. So we've extended it to any volunteer who would like to, you know, to utilize the service, because it's very reasonable to add additional people. What's interesting, everybody would like to, and then when you get them enrolled, not everybody makes the time to do it.
Right, but it's being offered, and that's good. That's good, because, you know, you want volunteers to have the tools also, and to make it a positive experience for your clients and for the volunteers. So
Yes,
thank
and one thing that we did change this year, we have our night manager is there every night in the beginning. And this ensures that all the rules are followed. She trains the volunteers as well. So I think that's worked out a lot better. Last year, our manager didn't work every night, and volunteers actually opened the center. So we found that this provides much more consistency. When a person comes in the first time, they have to fill out a form, 2 forms. One is a demographics form, because we do collect a lot of information, you know, like food allergies, medicine they have to take. We do ask them about their housing status, what medical needs they might have, like do they need a SNAP card, etc. People don't have to fill that out, and some people don't want to, but we do our best. The second thing is an expectations form that lists all of our rules and the consequences of breaking rules. So those are 2 documents that we do in Spanish and also Portuguese if we need to.
Thank you. Any other questions from the committee? With none, I want to thank you for participating today, and we will you know, be in touch with you if we have any other questions, but otherwise we will let you know the outcome of
Right.
deliberation. So thank you very much, and keep up the good work.
Thank you. Thanks for your support.
All right. Have a great day. All righty. So,
I know this is 4 minutes ahead of schedule, so we probably hop right into the next of
Okay.
Stephanie Sarah.
okay, and thank you. We have some in-person people today. So our next presentation is from the Lighthouse School. And if you could both introduce yourselves, and we are in a hybrid fashion, as you know, so the rest of the committee is up on the screen.
Super. Hi, everybody. My name is Stephanie Sarah. I am a grant writer for the Nantucket Lighthouse School. Thank you for having us. Being in this room is a little bit nostalgic. I find myself in here in January, often feeling better, but I don't know what it is. The new year, I received a cold of some sort, so, but I am here and healthy. And I am joined by Emily Miller, the head of school for Nantucket Lighthouse, and
Yeah,
Thank you.
sure. Hi, everybody. I'm Emily Miller. I am the head of school of Nantucket Lighthouse School. And we're here to present our grant to help fund our educational speaker series.
so I can roll right into the grant if that's helpful.
Yeah.
Yeah, so the educational speaker series, it started in 2017, but it had a couple of years prior to that, for development purposes. But this program, I feel, and Emily feels, it's a necessity to the human service of Nantucket in ways. We provide an opportunity for the community to come together, free of charge to the general public. I don't know where to speak. Should I speak into the owl?
In the
follow
owl.
you. Okay.
Yeah. The eyes of the owl is what's following you,
Okay.
and that's fine. Speak there because I can see you and.
Yeah, that's helpful. Sorry, I feel like I'm like,
Right.
okay. Yeah, so I mean, let me start off. Nantucket Lighthouse School raises and nurtures critical thinkers through the education. There's compassionate and considerate teachings, that have these children thinking outside the box, thinking about their peers, about their families, about the community and the environment that they grow up in. And the Lighthouse School does a lot of work in the community, advocates for the well-being and the health of the community and the general public as well. Through, festival initiatives, the RMV program in Massachusetts State, and our extended day program that is also an after-school care, Camp Lighthouse. And so, in all of our efforts, we think about the well-being and strengthening of our community. The educational speaker series is one of these things that does this because it brings conversations to the forefront free of charge for individuals, families, leaders of organizations, and agencies to come together to learn from professional speakers, around the world, in topics of behavioral health, mental health, youth education, diversity, equity, and inclusion, the arts, humanities, science. And by bringing these speakers here, we're building this bridge, over water where people can come and enrich our community with knowledge, with resources, and where we can host potential, strengthening of collective discourse, and offer these resources to community members to not only nurture critical thinkers in our children who attend Nantucket Lighthouse School, but to also nurture critical thinkers in the community and to strengthen leadership. So, this program, we feel it's essential. Currently, each visitor reaches 100 people in person, but we have a following of 17,000 online, and our initiative is, I think we've actually increased our following.
It's over 20,000.
It's over 20,000 now. And so at the time when we first started to stream these educational speakers, that was also reaching that number of people as well. Our goal for this next iteration, fiscal year 26, is to elevate, the range of speakers, but also, speaker fees and getting them to and from Nantucket increase over time. And so elevate and also think outside the box, what conversations could also benefit the community, and carry those conversations to hear from the people what might work as well within these topics that we discussed. Also, making sure that the program is accessible to Spanish speakers, perhaps Portuguese speakers, or making it accessible to those who are hard of hearing is an additional cost. And so these expenses, as we would like to grow the program, are essential in making sure that the program is available to everybody of the community, all ages, race, gender, etc. The impact of the program, we find it it hosts the conversations and it raises questions, sparks discourse, and you find that community members get charged from this, especially in the shoulder seasons. And so that's one of the goals, is just bringing together in the months, outside of the summer, especially throughout the school year, where to be a place where people can come and learn and also, collaborate on the discussion as well. Emily can speak a little bit to the
Sure,
history of
yeah.
the program.
The program, as Stephanie said, we started officially in 2017. But prior to that would bring speakers mostly from the Cape to the island to provide free professional development. That was our original goal. As we all know, living on the island, every time an educator goes to a professional development program off island, it typically costs twice as much to get there and stay there than the actual program itself. So, to attend a one-day event in Boston, it could cost up to $2,000 for an individual. And for our school, that was very prohibitive. And we felt like, how can we bring these speakers to Nantucket and also make the programs that we're offering accessible to everyone on the island, not just Nantucket Lighthouse school teachers, but public school teachers, new school teachers, and families on the island. So we early on partnered with the Nantucket Community School on a lot of the programs that we've offered since 2017, so that between both of our networks and resources, we were reaching as many of the island families and educators as we could. We create a lot of marketing materials when we host a speaker series event, and we share those with all of the schools on the island, and we use our very incredible following on social media, which is how most families are now accessing this sort of information. But throughout the years, we have brought leaders in education, mental health to Nantucket, and people who would probably be inaccessible to a lot of people on the island. We've had Tony Wagner, who wrote the book Most Likely to Succeed, and was very much a part of the revolution of 21st century education. We did a screening at the Dreamland. We partnered with them and screened his film. We had him Skype in for a Q&A. We've had Edward Hallowell, who is truly the nationally recognized expert on ADHD, come through our speaker series several times. But, people like Ned and Tony Wagner, and we've had Catherine Steiner-Adair, who wrote The Big Disconnect, a book that really chronicles the impact technology has had on both children and families' lives. These are people that we wouldn't be able to bring here on our small budget without some support and funding through grants. But events like the ones I just mentioned, we've had as many as 50 to 100 people attend these events. And now that we're able to live stream things, families who don't have childcare at night can actually watch from home. So our reach has expanded significantly. And as Stephanie said, we'd like to also be able to expand the people that we can bring here. I don't know if you're all familiar with Cindy Horgan, but she's been coming to Nantucket for years and years. She's an expert on child development and families. She lives on the Cape, and it's wonderful having someone like that come. But after a while, people feel like, oh, I've seen that speaker already. So we'd like to be able to move beyond and bring some more of these bigger names that are hard for people to access off Nantucket, just because of the costs of doing so.
Thank you.
Thank you.
Do we have questions from our committee?
I
I
have
see it.
one. I
Okay.
have one. My question is, for the programs that you're streaming, are you also able to record them? I know some presenters do not allow that, but is that something that you're able to do so that it kind of keeps the audience growing for the material?
We have had some of our events recorded. In fact, in the past, NCTV has done some of them. Laura and Chris from Yellow Productions did record at Hallowell last year. So as long as it's okay with the speaker, but again, that's another expense associated with the cost of hosting these events. So we just need a little more help because it can cost a lot of money just to hire a team to come in and actually do the filming of the event.
Yeah, and we're working, to add on to that, Emily, we are working with Pan Lecture Management, and so they're a company who's familiar with, you know, managing speakers, making sure that they, you know, feel comfortable at events, but also for the potential distribution or acquisitions of this material. That is part of the contract negotiation too. So that is informing this number that we requested from you guys.
Is it Pan Lecture Management?
And PANDE Lecture Management, yeah.
Thank you.
And then there's the Perception Institute, which is the other, and so they have restrictions and such, but it's a relationship and they're, you know.
So there, that's a resource for you to have access to speakers
Yeah.
and,
Yeah.
that they manage that end.
Yes, so the speakers that they represent, you know, throughout various topics, we find that those are some of the speakers that we are, you know, super interested in inviting here. But in addition, there's also independent authors and independent therapists and things like that as well. So we have a couple parties. Yeah.
And Sue, I think you had asked the question. So yes, we are, you know, not opposed at all to filming the events as much as we're able to afford to.
Great. Thank you so much.
Yeah.
Thank you.
If.
I have a
don't see
question.
any other hands.
I have a
Okay,
question.
Joanna?
Hi, Joe.
Hi, how are you? Thank you. I mean, I have, as a parent, I've attended many of these lectures and have very much appreciated them. My question really is about how you collaborate with the Dreamland, because in their grant, they mentioned you sort of specifically, and said that they were partnering with you because they've come and are asking for money for virtually the same thing. So I guess the question I would really have is, how are you planning to partner with the Dreamland, and how has that worked in the past? And is there a way, because we have so much more request for dollars than we have dollars to give, is there a way for us to achieve some, you know, economy in sort of pairing you up?
When we've partnered with the Dreamland, it has been around screenings of films because those seemed like the perfect partnerships. We obviously needed a venue to do a film screening. We're certainly, you know, we're not attempting in any way to be exclusive about what we're doing. So we're open to all of those partnerships. This is not a fundraising event for us. We're not making any money. We're utilizing our, you know, the school's resources to organize all of the logistics of these events. So we're open to those partnerships and feel very comfortable reaching out to Alicia. The speaker series is something that, you know, Nantucket Lighthouse School did initiate almost 10 years ago. So it has been a longstanding program at the school. And we certainly don't feel like, you know, we own it. And anytime that we can join forces with another organization and share in the cost and all of the logistics, we're happy to do that. You know, even if it's as simple as, you know, talking to Alicia, whom I know.
Okay, great. Thank you.
Yeah.
All right. I have some questions. How have you funded this before now? Because this is your first request to
Yeah.
us for this
Yeah.
funding. And I've attended some of your programs and world class and fabulous.
Thank you. We have funded it through the school's budget, our professional development budget, as well as some smaller grants that we've typically received from the Community Foundation for Nantucket, the Remain Nantucket Fund. So we've had a grant, you know, that one grant that we've received has allowed us to bring one speaker, where we typically try to do at least 3 speakers a year. across a variety of topics.
Okay. And I assume that your staff gets professional development hours for attending. Is that extended also to Nantucket schools?
Yes, yes.
Okay.
Yep. Yep, so they receive the professional development. We have, everybody sign in at the event, and we can provide certificates as well.
Okay.
Yeah.
Thank you.
Yeah,
All right.
thank you.
Good.
A question from Linda?
Linda?
Not all of your speakers are human services related, correct?
Not, well, they are educationally related. A lot of the topics have been around ADHD, diversity, equity, and inclusion. They've been I'd say 50% of them are about education, and the other 50% are about child development, mental health, and topics or issues that impact children's development and growth, like ADHD, sensory processing disorder.
Mhm.
Because that would be my concern if there were speakers that had no relationship to what our charge is, and money would be spent on those particular speakers. I would have some concern about that. That's the only reason I'm asking.
Yep.
Yeah, I think there's a really clear, sort of clear way to move forward with that distribution. There's this gentleman, Jason Harris, who does a program called Dignity and Repair in Times of Conflict and Crisis. And that's rooted in like community well-being. So would you associate community well-being and strengthening, community relations in times of crisis, a human service?
Yeah,
Topic?
human services
would.
really
Yeah,
is a
probably. Yeah. Big
very
broad
broad
thing.
umbrella,
Yeah.
and it's health, physical, emotional health of the community.
Yeah.
So it would fall under there.
Yeah, and just a little background about me. I mean, I come from filmmaking and producing, and I think that this program, if casted properly, would fit that, and I think we would actively work to cast our speakers to fit the collective goal. That's the reason we're coming to the
Right.
town, because in the past, the grants that we've received are helpful and they've been running the program, but we do need significant more amounts of, funds to support the types of speakers and resources we'd like to bring here. This isn't just a glam visit, like, hey, please come to Nantucket, and they want to come here to do work here with the community to help strengthen this place. So,
And one other thing I wanted to say is that the goal always was for families and educators to have access to programs that were going to support the educational and mental health well-being of children. So the reason we've never charged for this is we wanted every family to have access to what we were offering so that they could attend our programs like Raising Healthy Boys, Raising Healthy Girls, how to address challenging behaviors in children. And to me, that does contribute to the mental health and well-being of the community when we're giving parents tools to better parent their children. So that has always been the goal.
Last question and statement. As always, we have far more ask in all of our applications than the depth of our pocket. If we could not fund it 100%, would you be able to continue with what we would be able to give you?
Yes.
Okay.
Yes.
So we just pare down maybe the amount of offerings or whatever.
Right. Yeah. It's a program, as Stephanie and both said, began in 2017. We're committed to it. We've included, parts of it in our professional development budget. We continue to seek grants to help fund this, really for the whole community.
Thank you.
Thank you.
thank you.
right.
Thank you, everybody.
With no other questions?
Thank you.
Thank you for coming out on the snowy morning,
Yeah.
making the trek.
Thank you
All
for
right.
having us.
Thank you. So
We're
next
admitting.
we
Thank
have
you very much.
Addiction Solutions, and I'm Veronica Bolduc, and we have Yes.
Dr. Lipton's here, and I'm just admitting everybody else into this.
Okay.
side, but that-
Very good.
Everybody should be in now.
So Dr. Ledford, thanks for coming out today, and I assume we've got others up coming on the screen to join you? Yes. Okay, very good.
Yep, Alan Bell.
And
Burnett.
anyone else up there?
Maureen McAllister,
Okay,
Arlene
again.
Riley.
Lauren Murray Slaverino, nice to see you all.
And I'm Amy Skladnowski.
very good. So what we would like is if you can give us an overview of your ask and then the opportunity for us to ask some questions.
Sure.
Dr. Tekover?
I started Addiction Solutions about 20 years ago. And it is morphed into something that actually works. We have a very active board. We're a 501(c), and our lane in the healthcare area is medically assisted treatment of addiction. We see the full spectrum of addiction, from opiates to alcohol, to marijuana, to stimulants. So we see the full range of it. What we are doing currently is adding some people to our list of providers. Amanda Wright, who is a therapist, who will be working with us. A physician, Katharina Armstrong, who is boarded in infectious disease and addiction. Natasha Feely, who is a nurse practitioner, a psychiatric nurse practitioner, just starting out. Obviously, my daughter, Meredith Lepre, Aileen Womack, who's a nurse, and myself. We use the ordinary drugs, Suboxone, naltrexone. We also use Sublocade, which is injectable. This is a new program we're doing, and Vivitrol, which is injectable naltrexone. We take all comers. If you've got insurance, good. If you don't have insurance, good. If you got money, good. If you don't have money, good. We support our patients initially. If they do not have access to means, we will support them, but we generally encourage them to get insurance. We function Wednesday night from 4 o'clock on, Thursday night from 4 o'clock on, and Friday mornings from 8 o'clock on. When I say on, it can be 3 hours, could be 2 hours, could be 4 hours. We've had as many as 18 people we see on a Friday morning. So we're very, very busy. We have made some improvements. In succession plans were always brought up. I think bringing in Katharina Armstrong is going to be a big plus. She comes over from Boston usually once a month, but she's accessible by Zoom.
Right.
So that in the event I meet my maker, we have a continuity plan. We have just recently reviewed our bylaws and talked about succession, and this is the plan going forward. And that's what we do. Our main fundraiser is the Run for Recovery in the last weekend in September. We do receive donations because everybody has been impacted one way or the other, whether it's a brother, sister, father, mother, cousin, friend. Everybody's been impacted by addiction. And so we work with Fairwinds. We have a memorandum of understanding of Fairwinds, and we encourage our patients that require that long-term therapy to be involved there.
Thank you. Anyone else from Addiction Solution wanted to add anything to Dr. Leprie's overview?
I will. Actually, doctor, could you talk about the patients who have graduated? Because that's quite a success.
Well, we have a number of patients that have graduated. Addiction brings chaos into people's lives, whether it's alcohol or opiates in particular. And the use of these substances we have, Suboxone, naltrexone, and Vivitrol, and Sublocade, takes the chaos out of people's lives. 80% of our people have jobs, so their lives are out of chaos. Maybe they have kids and work, maybe a different type of chaos, but they're not waking up in the morning deciding how they're going to get either drunk or drugged. We take patients, we encourage them to deal with the problems in their lives after they're stabilized. And when they're ready to come off medication, they come off medication. We have one patient that I've known since she was in middle school. And she went through the throes of addiction. Now she's happily married with 2 kids, beating me in marathons or half marathons. Which is hard to see somebody like that. And a number of others that have graduated. And we have them ring a bell. And we've just had somebody come in this morning that is a success story, has a job, beaming and doing very, very well. So we have a lot of successes. It's interesting that we have put a policeman, Danny Mack, on our board, and a fireman. And Danny said, and I hadn't even thought about this, we haven't had an overdose death in a year.
Wow.
Fabulous.
So it works.
The Narcan program's out there too.
Well, then, listen, I'm not taking all the credit.
No.
But you know what?
No, but that's the first I've heard. That's
No,
It,
wonderful.
yeah, we have, it's something I was not cognizant of. He brought that up because he had checked all the state numbers.
Wonderful.
And
Wonderful.
it's correlating to like significant decreases in overdose deaths statewide too.
Yes.
So like the
Yes.
not my company.
I was thinking the same thing.
It's really because that program.
Any other members from Addiction Solutions? And if not, then I will turn it over to our committee for some questions. All right.
I just had one more comment. If Dr. Lepre could talk about our outreach to the minority community that we're trying to expand, also with Officer Mack, our efforts in that population.
Well, we rely on the emergency room refers us patients. Some of the other physicians at the hospital refer us patients. The police suggest to people that perhaps it's time to straighten out. We have hopefully going to get some of this bilingual. We don't have that currently, but I would look, we're trying to get somebody that's fluent in Spanish or Portuguese and cross over. I've worked with some of the translators at school to see if they can encourage within the emphasis they have within their populations. We have one young woman that used to drag individuals over. She would pick them up and bring them to our door. So we're making outreach to the minority communities because we don't have huge numbers right now, but we are seeing an increase in Spanish speaking and in the Black community.
I know it may be hard to quantify, but how many patients do you see over the course of a year, or at least individual patients? And I don't know how to quantify that.
Well, it's a funny number because we have people that come in the summer and they may be here for a week or two. We have people that we see on a monthly basis and some breaking out we see weekly or more frequently. So, I mean, let's say we had 900 patient contacts.
Mhm.
Now, out of that, how many individuals, I think it's difficult to tell because these crazy numbers, you know, we have somebody come in the summer on a boat. They're here for a couple of weeks and
And
we'll
then
see
they're
them
gone.
for a couple of weeks and then they're gone. And then we have other people we've been following for close to 10 years.
Okay, is there a standard amount of time if someone is on medication that they need to be seen by a medical professional, like monthly, or is it 6 months or, you know?
Well, no, we see everybody at least once a month.
Okay,
Okay, once a month and we check urine. Why do we do urines? Because
right,
I think it's important that people understand that we're not just passing out medication. We want to see people. They don't have to come, we don't have a set time to come off. They come off when they're ready to come off.
right.
And so if they express an interest in stopping the medication and they're ready, then we will work out a plan so that they come off of the medication gradually.
Mhm.
But we have steady eddies.
Mhm.
We don't have any wild and woolly patients right now. We have a lot of steady eddies and things are going along. We pick up patients every month.
I guess part of my question is, this is the third year that I have been involved with. So I've seen tremendous growth in 3 years, and thank you for some of the suggestions that I think we have talked about. So, kudos. Now you have 3 clinical sessions. Do you think that's the maximum? Or would you want to be, do you think that there's a need to expand further?
Right now, the way it is, the way we were set up now, I'm there for all of those sessions.
Right.
If my clinical practice were to close, then we would probably have more sessions.
Okay,
It's just, I like to be there. But now we're gonna have Katharina coming out, we're gonna have Natasha, so we're gonna have some other, and Meredith.
Mhm.
So there are people that can pick it up, but it's just that having started it, I have a certain vested interest in showing up and making sure things are going on. You know, it's just, I personally have a limited number of hours. Because I'm married and I have kids and grandkids.
Mhm.
Eileen is just a little bit younger than I am, and for example, she's having her knee operated on. And we're implementing everything to cover up her particular role in things, so. If I close my clinical practice, then we would have maybe 4 sessions. It just depends on our clientele. I mean, in the summer it gets, you know, if we're seeing 18 people, 18, 20 people on a particular day, then we like to try and spread it out.
Committee, any questions?
I have a question. I'm
Okay,
excited
that's
to,
Sue.
yes, sorry. I'm excited to hear that you're bringing on a social
We're having a
worker.
hard time. Can you make a little louder?
It's not her.
Sorry.
Yeah.
Is this better?
Yes, thank
That's
you.
better. Okay, sorry. I'm excited to hear you're bringing on somebody like Amanda, and I'm wondering what her role will be with the clients, just given that you're still excited about maintaining the fair winds for what I'm assuming is long-term counseling. So what of Amanda's many talents are you hoping to utilize in the program?
We don't want to get in particularly long-term therapy situations. But sometimes people come in a crisis, and then it is helpful to have somebody immediately available. And we can sort of anticipate that, and that's when we would be using our particular.
Excellent. Thank you.
Any other questions from the
Yep.
committee?
I have a question.
Joanna?
I'm just wanting to circle in a little bit on this number of people served sort of metric, right? Because if you have 900 patient contacts, right? I understand that some of that might be repeat people, but if we can get to like and you have these 3 sessions that you're open a week and you are doing, you know, some sort of testing of those people, we could probably get to this number by looking at the number of tests you were doing, right? So if you're, because I think one of the things that grant funders like to see is like the success ratio, right? So if you're having, I'm just going to make this up, if you have 50 people a month who are being retested over the course of a year, because we only really need to look at this in terms of a year-long calendar application, right? Is it 50 people a month? Is it 60 people a month? Because then we can come to really looking at evaluating a cost through which it takes to serve each individual person, right? And of course, everybody's different, but there's got to be some sort of more standard metric that we can apply so that it helps us determine how best to deploy funds. Because you may know this already, but we have so much more requests for dollars than we have dollars to give. And we've got to come up with some solution or success rate metrics. And especially because in the course of the next couple of years, this group really would like to have more money to give away. And the way for us to make that case is to be able to show how programs like yours, which help this community so much, are successful, right? And so I'm kind of making the help me help you plea, right? Right? Because, you know, that's the place where we are. You know, in order for us to help you, you have to help us show this success story in some sort of metric format where we're able to say, you know, look at, we've funded Addiction Solutions for 3 years. In that 3-year period, they've seen X number of patients, right? In that X number of patients, 25% of them graduated the program. 25% of them are still in the program. 30% of them were seasonal, right? 70% of them were year-round island residents. You know, and then you can kind of start to make a story of how Addiction Solution benefits Nantucket. Does that make sense?
I understand what you're saying. A crude metric is we haven't had an overdose death. Now, that is multifactorial. It's a little difficult to pick out of that because we have some people that we will see intensively for a month. We'll see them every week or twice a week. And then we have people that we're seeing once a month. We see everybody at least once a month.
Mhm.
So I'm wondering.
Right, so there's a good metric to start with, right? Like there's a good place to start.
Yep. All right, Joanna, Alan
Yes.
Bell. We
Hi,
actually
Alan.
do. Hi there. We do actually go by week for the whole year. We can actually send that to you. That way you can at least see.
Okay.
Right now we only have 24, but I'm sure Duncan has 23. But we can definitely send that to the committee if that helps.
Great, thank you.
And then,
Okay.
this is both a proposal towards Joanna, and then also when we get to writing the agreement for this year, we're gonna come to reportables, and I might work with everybody here to pick
Right.
out some representative data to report out on that.
It's a hard thing to really quantify because success isn't just graduating from the program. Success is functioning in the community daily. So it's not just how many graduates have you had.
I'm pretty sure there's a couple of things we can pull out that would give us at least a useful measure of what's happening with the process. I don't know how if it'll be perfectly representative of what's going on, but I think for the purposes of determining program efficacy, there's a couple of things, a couple of terms that I was thinking about while this presentation is going on that I think we can work out as part of the reporting terms for the agreement. But yeah, that Joanne, I'm gonna actually probably pick your brain on that when we get to that section.
Joanna,
Yeah, I
if
think.
I could point something out. Hi, this is Arlene O'Reilly. I work with Action Solutions in their marketing and communications. So I'm very much aware of how much traffic is going to the Addiction Solutions website, and I can determine where that traffic is coming from. So Addiction Solutions has had an increase of visitors going to the site, an average of, I believe it was 6,000 per month. And it increases during the summer. And so if that helps you, I know it's a little abstract because you're really looking more for the reporting and case studies probably from the clinic. But this is an indicator of people that are coming to the site. We can see where they're coming from.
Yeah.
We just don't know who they are because obviously that's a little
But you're
on that.
Arlene, what you're talking about is like that shows that there's a demand for the program, right? I think the metrics that we need to come up with is the impact of the program.
Yes, but I just wanted to point that out for you guys.
Thank you.
I have one more suggestion, Joanna. First of all, I want to thank you all for last year's grant, and what that gave us was an extra day to the clinic. So the extra day to the clinic added, I'm sure, many more people coming. So if we actually reviewed the 2-day clinic versus the 3-day clinic and the numbers that allowed us to treat in the community would be another metric.
That would be an excellent one too.
That'd be a grant presentation
Yes.
metric rather than a reporting metric, but that's a great example of determining
Yes.
efficacy. Yeah,
Yes.
or at least a good footprint.
With no more questions, I want to thank Dr. Lepre and your staff committee for coming today. And it is really exciting for me to have seen the growth in the organization over the number of years. And we do think that you are immortal and you will continue forever, but succession planning is important for any organization, whether you are 20 or whether you are 50.
Yes.
So that is a wonderful thing. So each year I've seen more and more growth. So it's wonderful. And that news of no overdose deaths in the past year is fabulous. And I know this is a portion of it, but it's a big portion of it.
No, I think the succession plan is important because I don't want to be weekend at Bernie's with them having me stuffed and sitting in a chair. And the success of our organization is due to our board. It is due to the people that are doing all of the work. And I'm sort of the pretty one of the bunch.
Okay, well, we've got a good one there for sure.
Thank you very much.
All right, thank you. Have a great weekend, everybody.
Thank you all.
Thank you so much. Thanks for having us.
Okay. And next up, we have Boys and Girls Club. Are they in person?
Nicole is should be on the Zoom. Hi, Nicole.
Hi, good morning, everyone. My name is. I'm the Assistant Director of Advancement here at the Boys and Girls Club, and I'm happy to be here. So thanks for making time.
Okay. If you can give us a overview of your grant application, and then we may have some questions for you. And we typically, if no more than 10 minutes in your presentation, so we have time for questions.
Sure. So the Boys and Girls Club is requesting $150,000 in support of the renovation of 2 spaces in our club facility, which will be used for our new program, the Club Junior program, which is our preschool program that runs from Mondays through Fridays from 7:30 to 2:30 p.m. At the moment, we have 2 underutilized spaces in the club, those locker rooms that I mentioned. I actually have the full floor plans for those, so I'm happy to share with the group if you're interested to see those, and I have some pictures too. So the renovations of those rooms, right now they're being underutilized considering that they're both locker rooms. And they currently have bathrooms that are not up to code with the safety levels for the Boys and Girls Club of America. So we are seeking to better use those spaces by making one a flex space and the other would be a locker room with up to code changing rooms and also single stalls for our members. As of right now, we're licensed for 20 children for our Club Junior program. We seek to be able to expand those numbers as the demand increases, which we know it will, considering the limited options for early education opportunities on island. And the $150,000 would support the renovation and also the materials and the furnishings for these rooms. So it really would be a big change for the Boys and Girls Club, and it really does change the makeup of the entire organization. This program has really been something that we've been wanting to do for many years, and we have found the time and the opportunity to be able to launch it. So we're excited for this new opportunity. We're excited to be able to improve it and keep it moving forward.
Questions from our committee?
Yep, I do. So,
Okay, Joanna?
so this seems very much like a capital project request. And so I want to understand the relationship to how it impacts your programs. Like, what is the relationship? How many kids does this serve? Who does this help?
So the kids that it would serve is twofold. Considering that our Club Junior program runs from 7:30 to 2:30, it would serve those kids that are enrolled in the Club Junior program. Additionally, it will also serve the kids that are here as general Nantucket Boys and Girls Club members because those rooms will no longer be in use, or rather, they'll be in use up to 2:30 for the preschool, and then they can transition into being used for our general club population. So it's really a twofold impact, which, I mean, we find it to be we find it to be an appropriate way to use our the facilities that we have, not only to support a new program, but also to ensure that our general population that we are serving has access to a variety of other opportunities. So, for example, right now, I'll be totally transparent and I'll say that we've switched up the operations of the club to to enhance our security measures to be able to ensure that we know where all our kids are at all times. And we've done that by dividing the groups of our general population to first grade through second and fifth grade. So first graders are their own cohort. And they often find themselves looking for a space to be able to play Just Dance. And as of right now, we don't have an enclosed place for them to be able to do that. So the renovation of this flex space would allow for a closed environment where they would be able to safely do the things that they want to do, and also not to disturb other activities that are going on at the club. So that's just for our general population. And then for our preschool program, it would offer the same opportunity. So there could be 2 activities happening at once, or multiple activities happening at once. And the second locker room, which will operate as a locker room and a changing room, will also offer more privacy for those kids in preschool should they wet themselves or should there be an accident. That happens fairly commonly. They'll have a private environment to be able to deal with that. So it really is a multiple impact change.
And I know that the preschool is a new program for you, and I checked, right? So I think right now your enrollment is pretty low, right?
Yeah.
I think I called and I asked, and I think they said it was like 5 kids. So that this is not, I guess I asked this question because I also think timing is important in all of this, and I'm wondering if there is a way to look at your request, because again, limited funds, right? Limited availability of funds, $150,000, right? Maybe there's a way to scale back your request.
I hear you. And I do believe that considering if we look at preschool independently, I do understand where that sort of concern lies. If you're thinking we're enrolling another child by the end of the month, so it'll be 6 children at the time of by the end of this month. So if you're looking at that independently, I can understand that request seems to exceed what we need here at the club. But when you think about it in a macro scale, I do believe that the $150,000 will positively impact, and we all agree that it will positively impact not only preschool, but also the 350 kids that we see daily at the club.
Okay. Thank you.
Sure, thank you.
And did I hear before that your license is for 20 preschool students? All right,
Yes.
and by the end of the month, you'll be at 6.
Mhm.
All right.
There is
And-
an invite.
I can.
Any other questions from the committee? Is that hand up, Sue? It's hard for me to see.
No, it's a
Okay.
no.
No? All right,
Thank you.
Linda? All righty, well, with no other questions, we appreciate your attendance this morning. And we will be back to you if we have any other further questions. And I think we have enough now to do what we have to do. So thank you very much. Have a great day. And very good. All righty. Thank you.
I have to leave for about 8 minutes to take Evan to work. He's not riding his bike in this. And I'll be right back. It's just down the
Alright.
road to the bakery.
Very good. And next we will.
Come right up here.
Come on in.
I think we have Lisa as well, who will be presenting for the Athenaeum.
Okay. Please have a seat. So is Lisa on?
She's on down there.
Okay.
Hello.
Lisa? Hi, if you could give us just a overview of your request, and it'll give us an opportunity to ask some questions, and we have about 10-15 minutes for your presentation, right?
Sure.
Thank you.
So the request is for $7,000 for a recurring film screening program here at the library. We would screen films that are kind of under the umbrella of wellness, but also difficult topics. We would also have a panel of speakers with kind of local professionals who have expertise in these different topics. And so the largest portion of the funding really needs to go to the director or the production company for the screening rights to these films. So it's a pretty low cost program. We have piloted this twice before. We've screened 2 films this past year, and we partnered with the Nantucket Cottage Hospital on one, and we partnered with A Safe Place on the other. They were really, really successful. I think it's a film is a really great kind of jumping off point to start a conversation with people about difficult topics like sexual assault, death, dying, depression, anxiety, racism, kind of all those sorts of topics. One of the things that's really important to us is having different films that are in different languages. So that would appeal to the diversity of our island. And yeah, that's kind of the idea behind it.
Committee, do we have questions from the committee? All right. I do have a question as to the selection, and how will you be making the selection of films?
Yeah, that's a great question. So I've been working pretty closely with Sarah Wright, who is the social worker at the hospital. And I should say I am also an LCSW, so I'm a licensed certified social worker working here at the Athenaeum. So we kind of have that lens to choose films that are particularly applicable to our community. But Sarah is, she actually writes a column in the newspaper, and she is a self-proclaimed cinephile. So I am as well. So between the two of us and kind of putting feelers out to other, professionals in who work at other organizations, we would go through that selection process together.
Thank you. Committee, any questions? No. If not, your application was pretty straightforward, so thank you very much for completing that, and we appreciate your time today. And if we have any questions, we will reach out. All right. Thank you.
Please do. Thank you so much.
Have a great day.
You as well.
All right. We now have a group here in person. Hi.
Are we the only one?
No, we have had people come and go, but thank you very much. So I'm gonna turn this way, but we also have
You guys had
committee members up on the
Get that
screen, so you probably should be talking to the owl there. And that's, that way you'll be,
I
up
will
on the
be
screen fine.
sharing- let me just, they have a presentation that they're going.
Okay.
So this, are you guys all seeing this? And I'm gonna move it so you can too.
Oh, I have here.
It'll be easier for me
hard
to.
copy.
And there's actually a little video in there, snippet.
Here.
Yeah.
How do I? It came through as a PDF, so I'm not sure where the. Is this legible to people? Okay. With your permission, I'll just use this.
Yeah, thanks, Joe.
No problem.
Well, thank you guys very much for your time and consideration. I'm Tracy Sears, the Executive Director of the Artists Association. And with me today is Francine Balling, our Director of Finance, and our education team, Liz Buccino and Lizbeth Fuller. So we just, like I said, want to thank you for your time, your consideration, but especially for your support over the years. You've made such a difference in what we can do for this community. So with that, I'm going to let the education team talk about what we've done in the past and what we're looking to do going forward.
Sure. Thank you for having us here. My name is Elizabeth Buccino. I'm the Director of Education at the Artists Association. We have the Wellness Through the Arts program that we started actually in 2015, and it has been such a huge success on the islands with our community. In 2020 during COVID, it really kind of took off as an opportunity because everybody was going through so many stressors and anxieties, and everybody's mental health was really suffering due to the isolation. So by implementing this program, we have taken away the financial barrier for our community to be able to come and to join together to learn new techniques and processes. And it's just grown, and we keep seeing an increased need for funding. So we, have received, increased our asks because of that demand. We had started out in, 2023. We were able to serve about 50 people. In 2024, that number went up to about 95 people. And this year we've served about 150 or so. And we've had to actually, almost turn away people because of that.
Yeah, we could
Oh,
share.
if you could
turn
fast
it
I'm so
forward,
sorry.
that's okay.
Next
So
one.
this just gives them
One more,
yeah,
yeah.
But I think in the slide before that,
yeah, just speak up.
just to highlight, what we've been doing over the years in building the program is listening to what people need, expanding our class offerings. People wanted a variety of classes, not just targeted classes, so we changed that up. We varied the class times to accommodate different needs. We've provided extra studio time for finishing work outside of that class. We've been designing classes specifically with therapeutic effects in mind, and we've also, as a staff, received ongoing training, including the QPR, the trauma-informed care, and CPR training. Go back to you.
Yeah, so, you know, with this rising cost of living on the islands, with this is like art is seen kind of as a luxury, and it's not something that people will oftentimes, you know, pay for because they know that they got to pay their rent, their electricity bills, they need to be able to put food on their table. And we're also seeing, you know, families, parents will oftentimes make the sacrifice for their children to be able to have something to go and do. And they always put themselves kind of last. This funding has allowed us to bring in those parents who would not have taken the class. And they're, you know, you get the idea is that you got to take care of yourself first before you can take care of others has been kind of an ongoing theme in feedback from people, that they weren't always able to do this and now they can. And it's incredible, like, you know, to see people coming there and the community and the relationships that they're building. You know, some people have gone in there not really knowing anybody in that they may be new to the islands. And, you know, we all know living on an island 30 miles out of sea can be really isolating. And then when you're older and you come to a new community, to make friends, to meet people is really, really difficult. And by coming to the Artists Association, they're making those connections. And then those connections go out into the island, to the community, and it's incredible. I was reading through some of the testimonials, just reflecting back, and I got really teary. And because I know as myself, as a parents, and when I first came here and having young children, and then the children grew, and you didn't have those connections. And by being at the Artists Association, I was fortunate to come and be as a teacher, and these people, these are my people, and just being able to share my passion for the creative process and knowing what it does for me, I'm able to, you know, translate that out to our students.
Well, I just met, the other day, I just met a woman this week walking in after her work at a nonprofit. And I said, oh, are you here for a meeting or are you here for Clay? And she goes, oh, I'm here for Clay. She goes, this is my saving grace of the whole week is coming here. She goes, she goes, I don't know how good I am, but I just love being here. And it's what keeps me going. So and that's just one person. We've had a lot of people who have said, you know, new teachers to the island who don't have a social outlet have been coming at night saying, this is where I meet people. This is where I can do something outside of my work. And Nantucket's just hard. It's a hard place for adults to gather outside of bars. And that's a problem, because where are these people meeting people gathering for some common purpose other than drinking or whatnot?
Yeah, you know, creating healthy habits is basically, you know, a big focus of it.
So this budget, right? It reflects an increase in cost due to our increases in which Francine and Tracy can speak to, payroll, insurances, materials, overhead, all those expenses have gone up, and plus we're serving more people. And we would like to keep that momentum going to jump our numbers up from this. I mean, if you look at our numbers from 50 to 95 to 150, 175, and we'd like to try to reach 200 people. Because even after we use the money, we still get calls. And we try to make it work as much as we can, even like trying to straggle funds from other places or other budgets, but we could use more money to be able to serve more people because the need is there.
Yeah, definitely so.
No, Teacher Jericho, I think that the next, yeah, go ahead.
So these are just some examples that, the arts as a way for wellness, it's becoming very much a known, a commonplace thing. The research has shown that it's, not only, stronger relationships, it helps with your healthy aging, adding 7.5 years to your life, physical activity, less doctor's visits, so it's
And a lot of that's
becoming.
creating community, because we know that social isolation creates a lot of problems. And on our island, we have to be careful of that because we're already an isolated community. And then there's lots of little people in their own little cubby holes who don't have that connection. And while we know the benefits just by our own personal experience of working with our students, now with this National Endowment for Arts research coming out, that what you'll see in this video, she's saying one of the most impactful ways to build community, create healthy aging, strengthen mental health and other physical health is through art
Classes.
Yeah.
So if you actually click on that and you, if you can get to that, you want to move to 2 minutes and 40 seconds. So I believe it's the time frame.
But I am
Does it allow
not
you to-
sure. That's.
All right, I mean, it's okay.
You can also
You can see it. We put the URL in there so
I'll
that.
send this packet around to
Great.
everybody.
Yeah,
Thank you.
in like the World Health Organization, if you just Google, the benefits of art on your, well-being, it's amazing how many, it's really, it's a thing now. So, and the studies show that it's super beneficial and it's really important.
Worth noting that the studies show that it's beneficial both for the social connections and then also separate from social connections when they control for that in studies. I did a lot of stuff on this.
Yeah, oh, good, yeah. You could almost go down a hole,
It's pretty compelling evidence in terms of efficacy.
Yes, definitely, so.
And then on the next pages, we just included a few of our students' testimonials, talking about their experiences. So for instance, there were lovely people in the class, and throughout that fall, I began to look forward to those 2 hours every Wednesday night when nothing else mattered but what we were painting. I made new island connections and learned a lot about color too. I hope this program continues for years to come. Somebody else, there's a teacher. I get so much more out of the sessions than just the finished piece of art. The classes have been a great way to decompress, relieve stress, feel part of the broader community, experience personal growth and well-being. Thank you for your past support with funding. This is a beneficial program worthy of continued support. And then our third was, as a teacher that is so unwinding, the time to unwind de-stress is so important. While I'm in our class, I can focus on what I'm working on, which I really enjoy, and forget about everything else for a little while. Over the past 3 years, I found myself going through some difficult times, and being here on island was isolating when my personal life was challenging and not in the greatest place. A few years back, art was something that made the chaos of my life quiet and peaceful. I'm pretty certain it saved my soul from the stress and pain I was going through. And we all know with the stressors going on on our island, with the economy of our island, the housing situation on our island, and what's going to go on what's been going on in our country, stressors are not getting less. They're becoming even more overwhelming. So we would like to be able to just build upon this program that has proven to have such momentum and success for our community.
And then these are just some photos from the classes and the individuals. We see a lot of multi-generational too, which is really a beautiful thing to see those, conversations happening. Down the lower left, it was a workshop that we were able to do for the One Book, One Island that we were able to fund, and watching the conversations between a 20-something-year-old and a 60-something-year-old talking about, just the spirituality and, the dynamics. It was just like be a little fly there to hear what was going on and to see those, and they talked about getting together, afterwards and for coffee to just have those connections. It's really powerful.
Yeah.
So.
And do you have questions for us?
Yeah.
All right.
We'll go to the committee first, if we can get back the. All right, so from our committee, do we have questions?
Sure, I have a couple questions.
Joanna?
Hi, Artist Association friends, nice to see you.
Friend.
You know, I love this program. I think it's fantastic. I think that the way that this started in this committee, because I think I was here when it did start, was that it was more art therapy based. And what I think has happened is it has morphed into a way for you to get underwriting to make these available, the classes available to the larger community. And I think that that's equally as important. I think that we just need to be clear that there's a difference between the two things, right? Because I think what I like about the change here is that you are giving this to 175 people. And I think that that is good for the community of Nantucket. So thank you.
I think, Joanna, I wasn't here when the original program started, when there was a professional art therapist on that actually was part of that class. And I think what happened is we, like you said, we couldn't have the varied offerings, and number one, but number two, we realized that we weren't the professional therapists. And what was best is if we focused on what the Artists Association could do. And so therefore, what we do best is provide art classes. And so it was a combination of being able to offer a variation of classes, opening up to a greater population because we could offer different times. And so I think in the long run, this was really the right thing. How it started, and that was pre-pandemic.
That was pre-pandemic.
Wasn't really sustainable
And
for the
also,
Artists Association.
I wasn't here, but Liz could speak to the fact that what you said is that people did not want to be funneled into that one class.
One class, yeah.
And also, I think sometimes those classes that are focused on the therapeutic effects can be intimidating for people because they're not necessarily know that there are other people and they're going to go in and be vulnerable. Whereas if you're coming in for a class that's whether printmaking or painting or ceramics, you can ease in and gain the benefits without having the pressures of, oh God, now what do I have to bare my soul with this group that I don't know? That's not, and wasn't the word was, thank you, but we want to take the classes we want to take, not just the ones that are targeted for this program, which was
how it morphed. Yeah. And we did listen to the committee after last year's presentation, specifically addressing what you said, Joanna. So we did have worked with the town and we've done some of the QPR training. We've done the trauma-informed care. We've had all of our staff as well as all of our teachers have come just so that they have some understanding of some of, flashpoints or triggers that could happen or things to look out for and what are the resources so that they could then, be like, hey, you might want to speak with, so-and-so, or just to kind of address that to know how to handle. We're not therapists, we're artists, but it's allowed us to get some information on that and how to handle that.
Yeah.
Question from Sue. Okay, Sue?
Joanna, did you have more before I?
No, I'm good.
No,
That was great.
okay.
Thank you.
I guess my question is, first of all, love art therapy, like all the cheers for that. I think it's great. I'm just wondering, is this like a general scholarship program? I'm looking at your website. I don't see anything about wellness and art. I see scholarship applications. So I'm just wondering, how do people access? Is this a different pool of funds? How does that work?
So how it works is we have compiled a list of about, I think there's 20, 30 different organizations, whether it's the fire department, the police department, Fairwinds, the schools, the public school, the hospital, the Interfaith Council, all the different churches, the different nonprofits. And what we do is we send out an email and ask them to share it with their community. And what they would do is the individuals then send me an email with their their top 2 choices. And then we do our best to accommodate those choices and to, this allows us to have a little bit of control over it so that we see as many people as we can. If we just opened it up to the general public on our website, people could be taking a class, a fully funded class multiple times, and we would only be serving a smaller amount of people. So by having them come through me, I'm able to work with them, field those. We've created a very large database, spreadsheets where we track who's taking the classes, when they're taking the classes, how many people are each in those classes. So we allot a certain amount of seats per class so that we can make sure that we're getting as many people as we possibly can. And people have been really good about acknowledging that, you know, they took a class, say in the fall, and they really benefited from it. They would hope that they could continue to take the class, but they know that they want to make sure that somebody else who hasn't had an opportunity to take the class gets a chance. So people are very much appreciative and understanding and not greedy about it. You know, they're willing to know that, and then they share it with their friends and say, hey, this is a really great program. So a combination of sending it out to the community through these different organizations and word of mouth.
And also, given that we've been doing this for a few years, we have people who refer people to us because they know about the program. So they get the heads up that registration is up and a new batch of, like, we've rationed the money so that we can have some for each semester. Not just use it all in one semester.
Right.
So that we've gotten people like therapists and counselors referring up, like both kids and adults, to see if they, and then those would be our priorities too.
And we do have actually a scholarship application on our website that I recently have just received, you know, about 4 of them just in the past couple of weeks. And obviously I wasn't able to offer it to them for this current winter session, but I email them and let them know, here, this is when I would like to offer you this for the upcoming spring session. This is when the dates are happening. Find your first 2 choices and email me and we'll get you into those. So it's kind of like, I also have that also as a separate tab in my Excel sheets of people who have filled out applications. Just because they found it on our website, they may not have heard about it. And there's a section that talks about, you know, the importance of, you know, why they want to take an art class. There's boxes that they can check where they're either a student, a winter, you know, year-round resident, veteran, you know, just an adult, you know, so it's.
I mean, wasn't Leah's watercolor class was just with police, people from the police department, people from the hospital, people from
Teachers.
teachers. So the class was largely populated by people who work for the town.
Great, thank you. And can I ask one, well, I just have one last comment, I guess, which is from last year and then this year, my same feedback to all of you is to continue to find ways to find funding outside of the CRC. Last year, you asked for 40,000, I think, and you were putting in your own 4. And this year it's sort of the same ratio. And so I'm looking to see more investment over time on your part for this program because it is really important. And I just don't know if it's something the town can continue to sustain with so much demand for other services. So that's my only thing, but I think it's great work and appreciate it a lot.
We have a very active grant seeking, you know, opportunities, you know, we knew that there was a lot of need for seniors, you know, classes and not being able, you know, that, you know, even a 50%, because at one point we had a scholarship for some funding for senior classes, but it was only able to offer a 50% discount. And we knew that seniors on a fixed income, you know, 50% was still a lot of money. So we have been able to find funding to offer our seniors. So we kind of pulled that out of the, you know, a separate offering for them. So we are very active in our grant funding and seeking. So I appreciate that. Yes.
If I could just clarify, because I'm trying to understand, you get the majority of the use of the scholarship program from referrals from 20 some odd organizations. So you've allotted those, and then scholarship applications that someone could just do on the website, that fills in the balance of it. Have you expanded your class offerings because of this
Yes.
money? So, more general classes and the scholarships fit into there.
Correct.
Okay.
Yes.
And we try to like make it so that not the whole class isn't funded, that they're paying people
a
also.
combination,
And
yeah.
like, so that we've tried to distribute it as, over the largest amount of people.
Thank you.
Yeah.
Just trying to.
Yeah, no, it's complicated.
Yeah.
You should see your spreadsheet.
I mean, we now have like 30, we have between the youth and the adults, we run about 30 classes a session, and that's, winter, spring, summer, and fall. And when I first started working with the Artists Association, I think we maybe had 20. So in those, it's almost 10 years that I've been at the organization, we've been able to grow that program because of the need. So we've, hired new teachers, and just branched out, versus not just painting, oil painting, watercolor, and ceramics. We now are going to be offering, we have some great printmaking classes. We have stained glass classes coming up. We've done basketry. So we've been able to kind of grow it in our offerings based on what feedback, and that's another thing we do at the end of a class. We send out a Google form, and we ask people to give us feedback, and like, what are they interested in? How did they benefit from this? Or did they receive a scholarship? And if they received a scholarship, to please give us, some testimonials. And people are very, very generous in offering those.
Also, another additional pieces, we have been hosting STAR program
Yeah.
for their weeks, because they'll come over with an educator, but they need a place. So they've been coming on a weekly basis.
And this is all on Amelia Drive.
Yep. All in
That's
So actually outgrowing that space.
That's separate from this.
Yeah, that's separate from this, but we're just really collaborating with other organizations, other nonprofits. We've done stuff with Mariah Mitchell for their science festival, the NHA with their families nights. We've been doing stuff with Egan, just really kind of making those, those community, partnerships. It's very much a big part of us.
Yes.
All right.
Yep, time.
So.
Sorry. No, I know. We could talk all day, Jericho. Thank you guys so much.
Surprise, yes, but thank you very much. And
Thank you.
if we have any questions, we will get back to you, but otherwise, I think we have a nice overview on where this is going, so thank you.
Thank you. Thank you guys so
And
much.
thank you,
Bye, guys.
committee.
Thank you.
Thank you. Have a good weekend.
Thank you, you too, stay warm.
Yes.
We have In the Herd with Michelle. Michelle is down there as well. Thank you, guys.
Very good, thank you. All right, Michelle, are you up on the screen?
Right there.
I am.
Okay.
Good morning.
Okay, good to see you.
You too.
And if I can ask, I'm Veronica, if I can ask just for a overview of your grant application, and then we will have some questions for you. All righty, and we have about 15 minutes for your time.
Okay,
And
excellent.
Good.
So Michelle Soderberg from In the Herd Cape Cod. We ran a program last year through the Youth Behavioral Grant, and that's why we're applying for this grant as well, to see if we can continue that program. We serviced just under I think 36 kids last year that we were able to work with the Family Resource Center, the Boys and Girls Club, the Nantucket Public School System, and gather these kids up and get them over from Nantucket to Sandwich and work with the horses for between 5 and 6 hours a day. We worked on leadership skills and life skills with these kids. We did assessments which showed that they had an awareness and growth of about 70 to 80, depending on which session it was, 70 to 80% increase of awareness in use of these skills. And what we did was we were able to provide transportation from the island over to Hyannis, from Hyannis to the farm. We gave them breakfast, lunch. We included that all, everything was covered in the grant, which was fantastic. So it was no cost to any of the families or children that were involved. It was a full day program. So like I said, depending on the boat schedule, we worked really well between the B bus, the DART bus, transporting the kids from Hyannis to the farm, and then from the farm back to Hyannis, and the High Line to get discounted rates and pricing for it. So we worked with them between 5 and 6 hours a day directly, with the horses. Primarily, it was about awareness and about working as a team, and again, leadership skills with communication. It's a building block curriculum that I went to school for in Canada that I've brought here to the kids. So what we found is that these kids I was really excited about the program last year and about getting the kids out here to the farm. But what I realized was a lot of the learning actually also took place on the briefing on the ferry, the whole transportation aspect of it, then coming to the farm, and then really the debriefing and talking about what we did throughout the day kind of soaked everything in for these kids. A lot of the kids were repeat kids that came back, multiple times throughout the year that we offered it. So we did end up changing things around a little bit. So that we brought in the care of the animals as well as the direct contact with the animals, just to give them some of the responsibility and we taught them how to drive the tractor, and we taught them about the skills and in what the dedication and the unconditional love that's needed for the animals. Which also brought in a different side for some of these kids, rather than just working directly with the horses. A lot of them had discussed with me that, they didn't have animals. They didn't have the ability of being able to contact any animals out on Nantucket. So it was really a novel experience in general for the kids, not only to be able to do the transportation, but to learn about how to care for and work with the animals, along with learning about these leadership skills and working together as a team. And we do a lot of problem solving and games with the horses, like, we do floors lava. We bring them into, we have like 5 or 6 different activities, obstacle courses that are set up where they have to learn how to move the horses together with another person. The horse is part of the team, so they need to use their body language. Sometimes we'll do silent communication. We bring in negotiation skills where the kids have to collect puzzle pieces with their horses after they've achieved and accomplished an obstacle. And then at the end, all of the kids get together and they get to negotiate with other teams to build their puzzles. Skills that typically are not brought into the school systems or an after school program were really the things that we were targeting here with this program. Things that they can bring out to life and utilize that we all need, that some of us, haven't, that we all could use more work on. So that's kind of the overall, that's kind of how the program ran. We picked the kids up at 7:15 for the 7:25, because myself and another chaperone would go over to the island. The kids would get their lanyards, so that we had everybody at a designated spot in front of the surf shop. We would gather all of the kids. We had a special 2 tables set up on the ferry that were reserved for us, so that we would make sure that everybody was all together at all times. Like I said, I had another chaperone with me. I have to tell you that it was probably, I didn't expect it to be as smooth as it was, but the whole transition went extremely, extremely well. From gathering the kids there at the surf shop, getting onto the ferry as a group, sitting together. We brought cards. We played a lot of cards and some other games on the ferry, learning about each other, learning how to communicate, learning how to be respectful in public. The kids learned that, we go on together and we get off together. We had to, so they learned about having patience and respect for other people on the ferry, because we kind of we expect that. Like we teach them that, like, this is what we do. We let everybody else get off, and then we get off together and we go find our bus. And it was really a beautiful, wonderful experience, not just for myself and my chaperones and other employees that worked with us, because we have an RN that's on staff as well. But it was a fantastic experience for the kids, and to see how much they grew from the beginning to the end of even just the simple day, the 5 to 6 hour day. So.
Okay. All right. I'll turn it over to, the committee. Questions from the committee?
Yeah, so
Joanna?
just, yes, hi, Michelle. Just walk us through like the metrics of this, which is how many kids per session? Were they the same kids over the period of time? Like, I want to understand a little bit more about that.
So yeah, it was definitely slow going to get this whole thing rolled out and to get the island aware of the program. It was, I have to tell you that I'm being here on Cape Cod, I could advertise this or send it to the school system, and I have a group filled within a couple of hours. So for a couple of months for us to get signups and to get this really rolled out on Nantucket was a completely different process for me. So I was new to that. I will say that the Boys and Girls Club helped. They referred kids over to the Family Resource Center, as well as, I reached out to the school systems and they referred them over to the Family Resource Center. The positive part about the kids going to the Family Resource Center and us partnering up with them, which they have agreed to partner up with us again, is that every time an individual comes into the Family Resource Center and applies for a program or signs up for a program, they get credit through the state, which helps their funding as well. So this was definitely something that was really positive for the Family Resource Center in the Nantucket community, as well as, the benefits that it brought to the families and the kids that came over here. So, so a lot of those kids did end up being repeat kids. It just, the word of mouth was a lot more difficult than I was expecting it to be. So I have reached out this, for this grant to all of the people that I have connected with, a lot of the families now, that their children had participated, I believe wrote like recommendations to please keep this program going. Some of them work in the school system. Some of them are just, obviously, employees and of the community of Nantucket that have been willing to help just spread the word to get the kids to come, to get more kids to sign up for it. So we did have a lot of repeat kids. We did have kids that came to us 8, 9, 10 times.
Okay, but how many kids went to each session?
On average, we had 6.
Okay, and you did how many sessions?
We ended up with 22.
Okay.
Okay. All right, I see. Joanna, any other questions?
Nope, that's good. Thank
Okay,
you.
Linda, I see your hand up.
Hey, I was, as you know, having been a lifelong writer, I was kind of skeptical as to how this was going to work about getting the kids over there, especially kids like mine that has anxiety, won't get on the boat, barely left the house today because there's 4 inches of snow. There are all kinds of those kids, and those are the kids that really benefit from horse therapy, frankly. I'm really pleased with how far this has come in just the past year. And I agree that it took a while for you to get going, and that's what I was worried about, as well as sustaining the trips and stuff and the bus and everything else. But it really kind of helps them with their confidence, I would think, being able to get on the boat, get on the bus, and then get on the boat. So I just wanted to say I'm very pleased with how far you've come and all the arrangements you've made and how encompassing your event is for these kids. So I'm just very thankful that you have done it, and I really wish you would find somebody here to do it with.
Is there any progress on finding how to do it on the island? Not that I think there's a big benefit of kids going off, but expanding to have a program on the island.
So I just want to say thank you so much, Linda, because it definitely, it was such a delight to see how all of this transpired and how well it did all come together and how smooth it transitioned and, what it did bring to the kids. Yes. So we have looked into that. There was a family that was fairly interested in working with me. I had given them some information on insurance, and it was kind of like the ball was bounced back to them. I'm not sure where they're at with that, whether they're still looking into it or not. I haven't had any contact with them in a couple of months. I have looked around to a number of other places. I've reached out, and there is nothing there's nothing available on Nantucket for this. You know, the horses living in the manner that they live in, the fact that we have different size horses, which makes a huge difference. But primarily it's about how my horses live, which makes them so beneficial for what we do. You know, my horses live in a herd environment at all times. So being able to bring their natural skills to the sessions is what we need. I have done this program with horses that are stalled every night, and it brings, don't get me wrong, it's still extremely beneficial, but it doesn't bring the natural instincts that the horses have to the table for teaching as quickly as they do when they live in a herd.
I can actually follow up slightly on part of that, which is the local family is still investigating, but the insurance issue is extremely difficult to get
Astronomical.
across. It's that, plus there were a couple of discussions of partnering with another organization that may have like coverage or umbrella coverage. And I think even that is prohibitive.
Okay, but you know, I do see the benefit of taking our students off island. For some, this is that experience beyond anything that you're doing is extremely valuable, and building confidence, and also confidence with parents, because that was the issue that I was running into when I was talking to people. It's like, well, can I go as a chaperone? Well, you know, and I think that you did have some of that, but eventually parents got the confidence also. So it's a growth experience all the way around. So, thank you.
We made sure that we always left room for parents to be able to come if they wanted to come. You know, that was included in this, so that their travel would be covered, that their food would be covered, you know, all of that. And parents did come. And I have to tell you that was the other reason for this, is so that we can expand this and hopefully offer this to other groups that are being offered through the Family Resource Center, because I know that they have male support groups, they have female support groups, mothers and father, you know, and we would like to be able to provide this for some of the adults that are out on Nantucket as well. And I've had kids that you know, they said that it was their first time coming off the island. Like, we had kids and it was their first, sorry, it brings tears, their first time coming off the island. That's huge. That's huge for them. So
many of us can't understand that, but for a situation like that, it is priceless.
and when we talk about the cost, you know, we were able to bring this just under $400 per kid per day for all of it, for all of the transportation, for all of the food, for this, you know, we even provide snacks on the ferry, all of their drinks, like I said, breakfast and lunch, and the bus transportation, having an RN on board that's with us the whole entire time throughout the day. The chaperones that, you know, because I bring an extra chaperone. So if a kid has to, you know, needs to use the bathroom, one of us goes with them, walks down to the bathroom with them on the boat, you know, so there's always somebody with all of the kids and somebody with whoever's wandering. So I feel like it was, we did well with the finances, and we were able to, you know, provide quite a bit.
One last question. Our ask overall is far more than the money that we have.
Yep.
If we cannot fund fully, can you go forth with
Absolutely.
what? Okay.
Absolutely.
So I think that also happened with our first round. So you would scale back to offer what you can.
Absolutely. Absolutely, we would. And again, this was if we were able to run it, you know, 3 weekends out of every month. I left a weather day because we certainly didn't want anybody to be disappointed, so that if we did have to cancel, which worked out really well, we did have to do that a few times. So this was literally if we were going to be able to run this 3 weekends every month for the whole entire year, and included over school vacations. So no, we can scale back for sure. And the community fund has, you know, has opened up again just as of 2 days ago. For funding as well. So I'll be putting in another application with them. In May, we have our Horses for Mental Health has their Mental Health Awareness Month, where we do a campaign for the whole entire month. So we will be doing some fundraising as well. And whatever we raise goes towards our programs.
Thank you. Linda, is your hand up again, or is it? Okay.
Yeah.
Sorry. Linda?
That whole last little snippet of discussion, I was going to ask you, what fundraising efforts, I know you do fundraising efforts for your program for the Cape area. Would that fundraising also apply to the Nantucket side, or have you looked into fundraising on the Nantucket side?
So I have not looked into fundraising on the Nantucket side yet. I do plan to. And the fundraising that we've done over here has actually come in grants through a couple of applications that I've put in, and then the Horses for Mental Health, which went to all of my programs. We actually have kept this quite quiet on Cape Cod because of the fact that I already work the juvenile department. I work with DCF. I also work with some private kids that come to me. So I haven't opened this up completely to the public. So the fundraising over here is probably not what you think it is, because of the fact that I'm taking in kids that are truly in need that the state's paying for. So I need, I only have so much time available and my horses can only do so much work. So, we're offering this, exclusively to Nantucket on Saturdays. And actually the majority of my fundraising would go towards Nantucket.
Okay.
I have a contract for Sundays with Newport Academy. So I work with all of their residential kids on Sundays. So really my fundraising is actually geared towards Nantucket.
Okay, that's good.
Thank you. All righty. Thank you, and appreciate your time today, and keep up the great work, for sure.
Thank you so much for the opportunity.
All right, very good. Thank you.
Appreciate it. Thank you. Bye-bye.
Thank you, Michelle.
Thank you.
Next
Sarah,
up,
great to
we-
see you all.
Okay.
Janice for that, with IFC.
Okay, and what I'm going to do is I'm recusing myself on this, so, Joanna, if you can just, take over for this next presentation.
Okay. Hi, Janice, how are you?
I'm fine, thank you. I apologize, but my distance eyesight, I'm far away from the room. I can't see who all the folks are. Yeah.
It's okay. This is Joanna. Sort of the ground rules are that we're going to give you 5 minutes to talk about your program, and then we'll take questions from our group and we can have a little bit of an interactive discussion. So you can get started. Thank you.
Could I ask a question beforehand? Is there
Sure.
anyone new to the committee who has absolutely no idea of what we do?
No, I think everyone is,
Because I don't want to be repetitive if everyone knows the basics.
I believe we have no new members from last year.
All right, fine. So, basically, this is going to be very repetitive and I'm going to be very quick. But we run 3 programs, 3 level 1 programs, that meet the basic needs of housing and food security and heating security on the island. We run the food pantry, which everyone, it's been around for 30 years and everyone is pretty well aware of how it runs. The pantry is currently located at the NRTA building downtown. And I think you all know that we have been asked to move. So that, number one, that is going to be a heavy lift for us next fiscal year. Currently, we're operating Tuesday, Wednesday, and Thursday from 3 to 6 with the home delivery on Wednesday. As a result of the food security previous state grant commitments that we made in fiscal year 23 and 24, we've increased the amount of food that we distribute. We've added a prepared meal program on Wednesdays. And we took over the pilot program of Fresh Connect from the NRP in July. And that program is still a pilot. We're not sure where we're going to go with it in the future because it is extremely expensive to run. But it provides a card to individuals where they can purchase fresh fruits and vegetables, basically on this island from the Stop and Shop. The rental assistance program provides temporary financial assistance to individuals who, for a period of time, cannot meet their commitment to pay their rent. That's because of illness and they cannot work or injury and they cannot work. We have a sizable population on this island, which are seasonally employed. Do not, their work either is eliminated or hours significantly decreased between November and May. A portion of those folks are not eligible for unemployment. So we fill those gaps. And then we jump in if to help people who are in substandard or not legal housing, and we help them to move into more appropriate housing, and we help to avoid eviction. The utility program basically runs from in late November to the end of March. We assist we assist the state contractor in Plymouth with the used to be called the LHEAP program, the Low Income Home Energy Assistance Program. I think it's now just called HEAP, but we help by helping folks who qualify for that program apply if they are unable to apply by themselves. More and more people are able to apply for that program directly online with the Plymouth contractor. We have a small contract with the Salvation Army where we can help 2 or 3 folks who are not qualified for LHEAP because their income is a little higher. But the benefit on that is very small, so it doesn't go that far. And then we have a direct pay program where we will pay a vendor to keep folks' utilities on. That be water, electricity, propane, and fuel oil. In that program, we will assist a family maybe 1 or 2 times in the heating system, and we will work with the vendor to try to get the folks on a budget plan so that they don't face the program going into the future. Those are the 3 programs. We anticipate, I'll just talk a little bit about what we're seeing this year. We're seeing the food program so far is holding steady. We saw a 21% increase last year, servicing about 2,004 households. We're on target for that to continue. We've had a little dip in December where some folks go away, but now coming in January, people are coming back. January, we're going to see that increase. We've seen a significant increase in requests for rental assistance. This time last year to this time this year, we have paid almost $80,000 more in the same period. In December alone, we paid $70,000 in rental assistance to 48 households in 1 month. So there is a significant increase in that program. There's a variety of reasons. There's the economy, the cost of rentals continue to go up. I believe there's a growing population on the island at the 50% to 80% median income. And because of the fine work that's being done by the other agencies, we are seeing a significant amount of referrals from the hospital social service office, from the Family Resource Center. I'm seeing an average of 2 to 3 referrals every day. So that program is mushrooming. Heating assistance, we're right at the beginning, and it will be hard to predict where we will fall out in the fall. And with that, I will turn it over.
Does anybody have questions?
I'd like to just say one thing because I think I need to get it on the record. We prepared a fiscal year 26 budget based on what we know. After we looked, just as we were writing this, we got the news that we need to move, the pantry needs to move. That is gonna blow this budget out of the water. We are working diligently, I mean, everyone's working diligently to find a location. We recognize that the NRTA and its growing program desperately needs the space we occupy. We don't fit in it anymore. But trying to find space is not easy. We're currently working on two scenarios. One which would be a rental in partnership with another nonprofit, or the other scenario would be a purchase in partnership with another nonprofit. I cannot go any further than that, but we are seriously going down that avenue simultaneously, but we recognize this is going to be an expensive proposition that we're going to have to spend a lot more time and energy on next fiscal year.
Does anybody want to ask questions before I ask a few? Okay.
No, I'm good.
So, Janice, I think you touched on a couple of the questions that I had, which was what are the plans for the future? But also, like, tell us a little bit about the timeline, like how, I mean, when is your lease expire? When do you have to get out? What kind of planning are you doing for this?
Okay. We were given, on July 1st, we were given a 1-year lease, which will terminate on June 30th of this year. I've been in discussion with the town. They will renew that lease for another year. But I think we would be stretching the limit to go beyond that. So what we have been doing, as I mentioned, we've been working with two different nonprofits with two scenarios of a location that is known. They're not guaranteed, so we're going down. In one, there is another nonprofit, and I'm not going to get into names and that kind of thing, is interested in purchasing a building, and we would be the primary tenant. That would be a rental situation for us. The other, with the other nonprofit, we would actually purchase land and build, we would secure land. I'd have to be careful about how I'm saying this. We would secure land and we would build a modular building fit to our specifications. We would be on the ground floor, and we would have the basement floor for all of the storage that now exists scattered around the island. And there would be workforce housing above. Those are the two scenarios we're giving all our attention to right now. On one, we're working with an architect on plans. On the other, we're working with that group on funding. And if something else comes up, we will jump at it. We have looked at 2 or 3 other locations on our own. None of them were large enough. None of them would have met the health standards that are required for a food pantry, so we did not follow up on them. But if something else comes up, we'll go down that path as well, because the clock is ticking.
So when does the lease end?
The current lease ends on June 30th. We will sign for another year, and then it will end on June 30th of 27. Yeah.
Okay. So, okay.
26.
That
We're 25 now, we're 26. It's not a fiscal year.
That helps me. And how are you?
Go ahead.
I was gonna say, and how are you doing on your succession planning? Because I know that that's been an issue that's come up a few times.
Yes. Well, you know that, I mean, everyone knows that Tom's commitment to the town in the select board area was keeping him away from progressing towards becoming the executive director. So we've taken a little turn back, and I'm deciding to do it a little differently. I'm in the process of securing an accountant who will work with us to build a reliable accounting. We have one, but we'll have someone look at it, do a review. What are we doing right? What are we doing wrong? How do we consolidate it? I know you've always had problems with looking at our budgets in a haphazard way. And we're going to hire an office manager or a program assistant who can take away some of the burden that I'm now doing, because I'm doing both the executive director and the director of rent and assistance. And to take that away, but also to train that individual to be able to do some of the basic introductory work for the rental and fuel assistance program, so that if I were to leave or something were to happen to me, we would have in place a food pantry manager, a director, a manager for the rents and utility program, and somebody dealing with all of the administrative work. And that will make it, I think that will make it easier to bring in an executive director, and maybe even not necessarily full-time if all of those places are in place. So we're gonna build from the ground up, because going the other way it didn't pan out. And now with the tremendous amount of work I think we're going to see with moving the pantry, to try to bring someone in and train them at doing both those two things at once is just not going to work. So we got to put all the widgets in place, and then we'll move towards getting an executive director, and either I will fall back full-time or I will leave and you will have a new program manager for the rental and utility program.
Okay, thanks. Anybody else?
No.
Okay. All right, Janice, thank you very much.
Thank you. Okay.
Thank you very much.
All right.
Thank you.
Thank you for the time.
Okay.
I almost thought about doing this online when I saw that snow.
Yeah, no, I know.
And if there's any questions, someone will be in touch with you, whatever.
Yeah, you
Okay.
guys, because
Yeah, it's
They're doing a
clear,
historical
it's
design,
clear.
but that should be clear and salted.
yeah, I took a humongous fall on the ice on Saturday. I don't want to
No,
take.
we're not doing that.
Be careful.
It'd be straight all the
Alrighty.
way through. They salted the path.
Alrighty, very
Thank
good.
you. I'll get out as quickly as I can.
Take your time,
Okay.
Janice.
Take your time.
I think we
Alright.
have health imperatives, and I believe everyone should be on the call.
Okay.
With Elizabeth Torrent popping in there.
Hello. Hello. Yes, three of us are on here today. Morning.
Excellent.
Okay.
Elizabeth, Kelly, and Jess. I
Alright.
recognize some of you and some of you I don't, but
Okay. Thank you for being here by Zoom today. I'm Veronica, and what I would like is that if you could give us just a overview of your grant application, and then we will have questions for you. And 10 minutes or so for maximum on your presentation, so we have some time for questions. All right.
sure.
Thank
Yes.
you.
Ready? Okay. Hi. So I'm Elizabeth Torn. I'm the Chief Program Officer at Health Imperatives, and I'm with my colleagues here, Jess Cisternelli, who's the Director of Sexual Reproductive Health Services, and Kelly Hicks, who's the Director of Maternal Child Health, and they both oversee some of the programs on the island. So I know some of you are really familiar with Health Imperatives, some of you might not be, so I'll do just a really quick thing. So Health Imperatives, we've been providing services for almost 48 years, 47 of them on Nantucket, so we've been there for a while. I read that 1978 lease all the time, so I know the dates by heart. Health Imperatives addresses, we have a lot of programs all over Southeastern Mass, but what they all have in common, what we have in common on Nantucket, is that we try to address health disparities, a growing wealth gap, serving people who may not otherwise get services for a variety of reasons, have barriers to good health. English may not be the first language, they may be youth, they may be immigrants, people with substance use disorders, and also people with histories of trauma, various kinds of trauma. So since being on the island 48 years ago, when we started as family planning, which is really pregnancy prevention, we've continued to grow and expand our services, again, in Southeastern Mass, but on the island too, to respond to the growing needs in the community. So we used to call our sexual reproductive health services family planning, because we did pregnancy prevention and STI prevention, sexually transmitted infections treatment, but we've heard from the community, from our clients, and seen the needs. So we've expanded to additional services like gender affirming hormone therapy, hepatitis C treatment, testing and treatment, HIV prevention medication abortion a year and a half ago. We started providing WIC services in the 80s. And we can talk to you about that a little bit. Most people know what WIC services are, but I learn something every day about our services. We also provided it starting in the 90s, Healthy Families, a Young Parenting Services Program, Support Services Program. And then just a few years ago, Harm Reduction Services, to meet a growing need out on all our communities, but none less than Nantucket with substance use, misuse disorders. So that is kind of like a nutshell what we're providing. We want to continue providing the services that we do. We think they're very vital. We serve a growing complex, I would say, population. Many immigrants, many people whose first language is not English, have barriers to health, as I said before. Uninsured or underinsured. And we will say that with recent election, there's a lot of fear in our patient population and client population about deportation, lack of services, lack of access to services. And we are proud that the services that we do offer, health impairers, there are no eligibility requirements about being health insurance separate. That's very different. That's why people can't get health insurance, but our services, there are no, you don't have to, documentation and immigration status is not considered. We see people of, as we say on our signs, all sizes, shapes, languages, ethnicities, races, religions. We're here to serve and serve well and do it with as much quality and quantity seen to meet people as we can. So I'll turn it over to Jess and Kelly if they want to talk a little bit about the what we're proposing to continue providing those three services. I think you guys have the amounts. We asked for $125,000 for the CRC and $25,000 for the substance use. So you guys want to take it away? I know I'm talking fast, but I know we have limited time, so sorry. Hope you can keep up. I didn't have that much coffee, but.
Thanks, Elizabeth. Yeah, I just, want to reiterate what Elizabeth had said. We're really committed to serving the island community. The support of these grants really helps us to be able to continue the good work that we're doing on island. We have multilingual staff who live full-time year-round on island, working in our programs. And I think that is very important that we are also part of the communities that we're serving out on Nantucket. We really are focusing on the most vulnerable, but anybody is welcome to get our services. We really pride ourselves on providing that really high quality, client-centered medical services within our sexual and reproductive health clinic. And the support of this funding allows us to continue that, particularly with the substance misuse grant and expanding our harm reduction program on island. We've had some successes and some challenges, and we're really trying to overcome some of the challenges we faced this past year with getting more Narcan into the community, more education about substance use, misuse, treatment, overdose education and prevention, supplies for folks who are using drugs so that they can do it as safely as possible, and hoping to just reach more people coming into this next fiscal year. Thanks.
Kelly, you want to talk about WIC at all?
Sure. I'll be quick. Sorry. Currently we have 235 people on our WIC enrollment on the island. And I think a number that proves how much it's needed is that 200 out of the 235, 233 people actually redeemed their benefits last month, which is like an extreme number. It's not like that around the state at all. And I just have a quick story to sort of sum up some of the services that we provide other than the WIC services. We had a young immigrant woman come into the program and stayed with us, got the nutrition counseling and all the groups that we do for breastfeeding and support and referrals to the community throughout her pregnancy. Unfortunately, she delivered a stillborn baby at the end of her pregnancy, but because WIC allows her to stay on for 6 months past a miscarriage or an abortion. She stayed with us for 6 months and we could monitor her and make sure she was getting the grief counseling that she needed in the community. And she stayed connected with us even after that time. And now she has returned to us pregnant again. And she has restarted the services, and she is attending, Alice is our nutritionist on the island. She's attending Alice's breastfeeding groups. So it just shows how important it is to have somewhere for people to go to and trust. So that's my. Thank you.
Just a couple, a story about sexual reproductive health, and just jump it if you want to, but that we've seen a number of, again, like immigrants with abnormal pap smears screening for cancer detection. And because we expanded services and offer LEAP, which is a procedure, we offer 2 procedures actually when you have an abnormal pap, so that you can visualize and see it, and also do biopsies and do some treatment. Because we do that now on site as of the last couple of years, where our medical director comes over, we've been able to catch a few pre-cancer people with precancerous cells and treated them that they probably wouldn't have been caught if they hadn't come to us. But also they didn't have to go off island. So many people don't get the needed medical care follow-up, and because we offer it right on site, they're able to do it, and they're in our system now. They're under surveillance, and we're going to prevent them from getting cancer. So that's just, you know, it's kind of an extreme, but it's a really critical, it's a critical thing that we offer, so that we're proud of. So I hope we didn't over
question.
I think
Questions from the committee?
I
Joanna?
Yep.
Yeah, hi, Joanna.
Hi. So, I mean, obviously your services are invaluable to Nantucket, and we appreciate them in a very significant way. And we funded you all for a very long time. And I know that you likely know this, but our requests far exceed the amount of money that we're able to give away. And when I read your grant proposal, I love the specifics that you shared today. I think the WIC example is a very good one. But I'm concerned that this grant largely underwrites the cost of staffing. And I think that one of the ways that we really need to look at this is service provide. How are we supporting the cost of service being provided? So I think that the way in which this is communicated to us needs to shift into that language and those metrics.
Okay.
Because otherwise your grant reads that we're giving you money to underwrite salary cost, and that's not program support, right? So when you talk about 235 people using the WIC cards and the redemption being 233 people, that's program support, right? So I think reframing how it is you are talking about this and how it is you are describing the success of your program needs to shift
That's helpful.
into those program specific examples.
Yep. Okay, that's helpful. That's yeah, it is staffing that provide the services. So that's obviously the bulk, but we have lab services and medical services. As you all know, the costs have increased tremendously. So is that something that you'd want us to kind of revise, or how?
I mean, Veronica, I think yes. I think giving us support to your request in those metrics will help us do a better job of allocating the funds.
Yeah, because we see, like Kelly said, right now we have 235 people, but over the course of the year, we see about 400 people on WIC and about 600 people for sexual reproductive health. We serve over 1,000 people, and then we provide so much community education. Alice is out there doing breast support groups and child health education groups, and we're working on the obesity groups and nutrition. So there's, yeah, we do a lot of the services, but the staffing is the bulk of our cost, because it's a nurse practitioner, it's 2 counselors, it's a nutritionist, it's a program assistant. But I see your point. Like, what are the outcomes of that?
Right, so translate that into, and it's not cut and dry, but a nurse practitioner sees X amount of patients. So we then can look at it through the impact on the population on the island. So if there's a way
You can
to,
get some more detail, Joanna, we can talk offline about like specific details. about this, and then I can communicate them to Health Imperatives.
Right.
Okay.
And, you know, Joanna alluded to it that, of course, our ask from our grant applications far exceeds the money that we have, so if there's a need to pare back or fund less, is there almost like a list of priorities that you could provide?
Mhm.
I see Linda's hand up.
I think you guys do a spectacular job. And I agree with what the last two speakers said, Joanna and Veronica, about prioritizing if we don't have enough money to give you all of it. But I also disagree, because without heavy staff involvement, none of this happens. It's not quite the same type of service that we have with some of the other applicants. This is heavy staff involvement, because without the staff, nobody gets any of these programs, period. And you have so many different programs that you offer that, and so many good things that you do for the population here. I mean, 1,000 people, that's a lot of people. And they have nowhere else to go here, because we can't just drive down the street and go to a clinic on the Cape.
Right, there's
So
no
I really
community health
appreciate
center.
No, nothing. So you guys have been it since I first moved here in the 70s, and it was family planning. And I really appreciate, because I went to it back in those days, because I didn't have a primary caregiver. And I'm just so in awe of everything that you do. And I do support paying for staff, because without staff, this isn't happening. And I love that WIC program, because I did it for years for all 3 kids.
Yeah, we're a safety net provider. That I don't. That it's a horrible word, because it's like, yeah, we're like catching people that don't have other services, and we have a lot of communities that have community health centers, and we still are busy because of people not accessing that for a variety of reasons. You know, so thank you. I appreciate the feedback, and yeah, send if you want. If you'll send us like what you want, we can revise it and.
Okay.
Or try to put into metrics, like the importance of the staff and what they're doing, to Linda's point.
We'll coordinate that with Jericho, and you will get that from Jericho in the next couple of days. But we appreciate everything that you do, and we appreciate the time that you took in coming to us today.
We
And
appreciate the town support. Believe me, not all towns are like you. You know, so it's really,
thank you.
It's critical.
And we will be back in touch with those questions for you, and if there's anything else. And otherwise, we do appreciate your efforts and your time in coming to us today.
Thank you so much. Have
All right. Have a
nice
good
sunny
weekend,
day. Stay
everybody.
warm. Bye.
Thank you, guys.
Thank you.
All right. And
Looking at Kim.
I'm looking, I see
Amanda.
Kim Mead Walters, and do I also see
Looks like Amanda. right?
Amanda? Okay, you know, I'm sitting so far away, I can't see the name, but I saw how you sit and I said, that looks like Amanda. So welcome.
Good
All
morning.
right.
Good morning, everybody.
right.
We sent ahead, I think it's a 12 slide, because we just want to do a brief introduction to folks who don't know us, and then we'll zip through the 12 slides and then be available for any questions.
Thank you.
Thank you.
I'm gonna move it so everyone can see it.
Thank you, Jericho.
Not up, well, let me get it up there and running first. Okay,
Okay.
there we go. Slideshow. From the beginning. It'd be just a second, because we're streaming it rather than playing
Okay.
local.
Almost there.
I believe. There. There we go.
There we go.
Oh, fantastic. Thank you so much. So, good morning, Contract Review Committee. I am really pleased to be here with you and hopefully ending your morning. My name is Kim Mead-Walters, and I'm the Executive Director at Sharing Kindness. Next slide, please. As our primary location is off island, I want to take just a few minutes to review who we are, why peer grief support is needed, and how we actually get the work done. Next, please. So the who. Sharing Kindness actually began with myself as ED and co-founder, and Kathleen Shine O'Brien, licensed mental health counselor. Kathleen is now our Director of Clinical and Community Services. Next slide. We have a small but mighty staff that lets us get a lot of work done. Next, please. We work with 12 trained clinicians. So these are licensed clinical social workers and licensed mental health counselors who contract with Sharing Kindness and lead our groups, our peer grief groups. Our WHO also includes 22 trained volunteer co-facilitators, often with lived experience. And our foundational models are the Dougie Center, which is the National Grief Center for Children and Families, and Wolfelt's companioning model. And I've included the links to both of those sites here. So all of our clinicians and all of our volunteers are trained in this model. Next, please. So this is a graphic of our work within our shared community. I will be very brief. If you look down at 7 p.m. on this slide, we provide peer-based grief groups across the lifespan. And this is where the adult peer grief group program that we're proposing to CRC fits in. Moving around, Grief 101 improves grief literacy in our shared community. We also provide community support, education, and advocacy to raise suicide awareness. And since June of 2023, we've been involved in a number of panels and documentaries shown on the island. We provide now school-based peer grief groups on Cape, not yet on the islands. We host the annual Cape and Island Suicide Awareness Walk. We provide students with evidence-based suicide prevention curriculum such as QPR and Hope Squad. And we offer a legacy grief response to support an unexpected death in a workplace. And I want to stress that each of these programs is designed to fill a gap in service. Next, please. So these are the flyers for our family grief group in person on the left in Harwich. We're really excited about the program on the right. This is new for us. It's a virtual family night, again, clinician led. This lets a family that's bereaved of a grandparent, a parent, a sibling, whether they're living in Truro, Bourne, on Nantucket, they can all attend the same family night together. So again, new for us this year, but we're really excited about that. Next, please. Here are the flyers for additional programs. You can see in the back center, the adult grief group, which is where this program would fit in, ages 18 and up on Nantucket. At the bottom center is a flyer for suicide loss survivor groups. Sharing Kindness has an established suicide loss survivor peer grief group on Nantucket. We meet the fourth Wednesday of each month. And really what I want the take home to be from this is that we have the ability, we have successfully done this program for bereaved adults, and we are successfully have a program on island already. And I want to add that under in the bottom left corner, perinatal loss peer grief group, we work with Cape Cod Healthcare's Maternal Child Health VNA, and we have an established and thriving perinatal loss program on Cape, and we are in the early stages of getting one started on island because of a request by the VNA. Next, please. This is a bit of information on the school grief groups that I mentioned. Again, very big growth this year. We did 2 pilot programs last year, meeting children who did not have the resources to get to our groups where they are. We are doing 10 programs this year across 4 different school districts. So again, not on the islands yet, but it's something we would love to bring to the Vineyard and to Nantucket. Next, please. So here is the why peer grief groups. The public health toll of bereavement is well documented. This information I'm sharing is in an article from the Lancet in March of 2024. Why? Because bereaved adults are at increased risk for a number of adverse outcomes, for mood and anxiety disorders, for decreased work productivity, for adverse health behaviors. We see that often. Neglect of their own health care. We see that also. They're at increased risk for cancer, heart disease, suicide, and death. And so we at Sharing Kindness, we want to be part of a coordinated effort to decrease these risks, a part of upstream prevention. So this is our why. Next paragraph. Next slide. I mentioned that all the programs our clinicians lead across the Cape and Islands. We always do pre-group and post-program surveys to see if we are meeting our goals and indeed if we are meeting their needs. I'm sharing some of the results from June of 2024 with you, and I really want to stress the first finding. Participants felt safe. Each member of the group realizes that theirs is only their story to tell. That's the only story that they should tell. And I know how important that is, certainly here on the Cape. We've heard time and again from the group that we do have on island, how important that is when folks are living on an island. So 100% of our participants felt that their group was a safe space. And I also want to stress the finding that the majority of respondents reported that when they feel overwhelmed by grief, there are people they can now share with. 97% answered positively. And we see this. We see participants exchange texts, they exchange calls, they meet for walks. So the ripple effect of building community and connection, it's amazing to see, and it's incredibly rewarding work for us. Next slide, please. So this is the how we would start a group. Our grief-sensitive, trauma-informed clinicians, they support our organizational goal, which is to fill service gaps. We understand that there is an excellent palliative care group on island providing support, and that's really wonderful because we do not have that experience with anticipatory grief groups. Our expertise is in supporting those who've experienced unexpected, traumatic, often stigmatized deaths. We determine need, we locate funding, we build a registration on our website, we identify a clinician, and at this point, I want to share that one of our favorite Nantucket people, Amanda Wright, who is on this call, Amanda became a trained Sharing Kindness clinician last fall. She came here, we had received funding elsewhere to do training. We bring in a Dougie Center trainer from the West Coast to work with our Dougie Center trained director. And Amanda was able to participate in that training. And she is available to facilitate this group along with a trained volunteer co-facilitator. We identify a meeting site and a meal source because each of our groups, evening groups, begins with a shared meal at 5:30. This is a beautiful way to build a community. It also makes sense at the end of the day. And then the group runs from 6 p.m. to 7:30. We would order Translate live. This is an amazing device. I don't know if anyone's had experience with it. We found out about it through a school here on Cape. Imagine a grief group of 12 or 15 people, and one or the two of the people perhaps speak Portuguese primarily or only, and another portion of the group speaks Spanish, and the facilitator and the rest of the group speak only English. This device lets everybody be seen and heard in real time. We have purchased one for use here on the Cape, and 3 of us on staff, and Amanda was able to join us virtually, did our training on this device earlier this month. We then would begin outreach via collaboration with healthcare, other professionals for bereaved individuals 18 and up. I will share that particularly with unexpected stigmatized deaths, a lot of our referrals come person to person within the community. It does not matter when the death loss occurred. We've had people join quite quickly after a death loss, and we've had them join years or even decades later because they hadn't had the opportunity to grieve that loss when it occurred. Each individual after registration has a brief intake with the clinician to set expectations and to make sure this is a safe and appropriate group for them. We would start the group in September of 2025, do a pre-group survey, meet monthly through June of 2026, and then of course offer a post group. We would have a goal of 15 people in this group. In our experience, some people continue with the group indefinitely, and some come, feel that they've received what they need, and then move on, which allows new participants to join. So based on our prior experiences, I would expect 20 or so direct group participants, but there will be many others impacted by the ripple effect as participants share with others what they've learned about how best to support each other in grief. Last slide, please. So a big thank you to CRC for having me here today. Amanda, thank you for becoming a grief-sensitive trained clinician, able to work with a Sharing Kindness and allowing us to make this proposal. Any questions?
Thank you, Kim.
You're welcome.
Excellent overview, and you actually answered most of my questions in your presentation. So
good.
This is Veronica speaking. The question that was most, mine is what you're looking to bring is a sudden death or unexpected death grief group, because we look at what we have on the island, we do not have that. So you are filling a gap.
Correct. That is our goal. That's what we've heard. Yes.
Right. It's filling a gap. And the other, and this is just a general comment, you're a new organization for us on the island, and you're doing fantastic things off island. It is wonderful to expand your footprint on the island, and hopefully this would be the beginning of future opportunities to offer more of what you do well off island. So
I can
Jericho?
also add on, they're new to the contract review committee, but they've been working with the Health and Human Service Department for almost, I think, a couple of years at this point, providing significant assistance on a couple of long-running programs and long-running goals that were outputs from the behavioral health study from a few years ago.
Okay.
So they're not an unknown organization for us.
Right. But new to our funding source.
Yes.
So, yeah. Linda, I see your hand up.
Yes, I'm not familiar with them. Unusually, I'm not familiar with this particular group. Do they work with NAMI? Do they work with Fair Winds? I mean, is there some crossover here? That was one thing. My second question is, are you available in a crisis situation 24 hours a day, since you only meet once a month? And you have a place here that you can call your own?
Are those the questions, Linda?
Yeah.
So regarding crossover, we collaborate often. We have collaborated with Fairwinds, and I know that Jericho's been a part of. We've done a lot of planning meetings about bringing resources and information since June of 2023. So coming up on 2 years. You're right, Jericho. We do a lot of work with Jackie Lane and NAMI here on Cape. We haven't, aside from some of these presentations and panel discussions, we haven't done any work on Nantucket with NAMI, but we do, absolutely, there is crossover. We are not a crisis organization. So we would not be somebody that would have 24/7 services available on the island. That would fall to the crisis team that you all have. And that's the same way that it does here. Our, as I reviewed in the graphic, we have a lot of points of connection, but we're not a crisis provider.
And
Did
you
I
have a
answer
place
all
here
your
that-
questions? Oh, do we have a place there? So we are so fortunate in that you all have some really generous organizations. Our suicide loss survivor group meets at the Community Foundation for Nantucket in the evening. They give us that space. The perinatal loss group that we hope to have off the ground very shortly has been offered space at the Family Resource Center. And so we do not have our own space, but we are partnering to use space there on the island when it's not being used by other community partners.
Great, thank you.
Excellent collaborations.
Yeah,
Yes.
thank you. Amanda, anything that you've been so key in helping us with those collaborations? Anything that you would like to add?
Yeah, I think that, I mean, Sharing Kindness has been a wonderful agency to work with since, you know, we were introduced to them when I was working at Fairwinds after the 3 suicides in June. And they stepped right up along with Department of Mental Health and other organizations in the town to kind of work together to figure out what are the needs on the island. And I have to say, you know, just from running crisis for the 2 years when I was there, a lot of times we were looking for like, what's next? How can we get this person or this family help? And I have to say, a lot of the referrals for the peer suicide support group were from Fairwinds, you know, when I was working there. And I can think about some of the tragedies that we experienced even last summer with the 3 deaths due to drowning. And the harbor master reached out to me, and obviously that's different than a suicide. And it was just, unfortunately, there wasn't an opportunity of a group that was available to be able to help support these individuals. So it was either, you know, individual counseling. And I think some appreciate individual counseling, but some feel more comfortable being in a group setting. And I think the wonderful thing that I've seen from the peer suicide support group is that they really do become their own sense of community and support each other when the group's not meeting. And they help refer people to the group. And it's just, it's a huge need on the island. We're seeing loss all the time.
Well, thank you. Any other questions from our committee?
I do.
Okay, Joanna?
One of the questions that I have, like, this is great. Thank you that was a good presentation. I looked on your website and I looked at your board of directors and I saw that there's not any local representation from Nantucket, right? And that concerns me.
Thank you. That's a really valid point. And that's something we're trying to correct right now. So I will share that we are just turning 6 years old, and in December, 3 of our founding board members, because they can do 2 3-year terms, exited, and we are actively looking for representation, actually from both islands, because we're starting services on the Vineyard also. And so, so I totally agree with you, and that's something that we are in the process of rectifying.
Okay, I think I had, let me see if I had any other question. Is there anyone else offering these services? I mean, first of all, I'm thrilled that Amanda's doing this with you too, because she's very plugged in here. And I think I think that's a good bridge in terms of you not having a local board member sort of type representation. So I'm encouraged by that. But what I'm wondering also about is like, where is the service gap? Right? Like that you've identified this niche, and I hear it and I acknowledge, yes, that is, but who was doing these services and how are you, like, you're additive, right? Like we're not taking anything away from this space, but we're adding to the space, right? So who are the partners?
I'm going to try. I think I understand your question. If I don't get it, please let me know. So There is actually on Cape and I believe on Island, and I'll go back to the, I think our conversation about doing this group started with the 3 unexpected deaths by drowning, that there is nobody doing this unexpected traumatic, and those were not stigmatized, but often stigmatized deaths. And so we're stepping into a space that I don't believe, unless there's information on the island that I don't have or haven't learned in the time that I've spent there, about that need. I will share that I feel really honored. I am a suicide loss survivor. It's one of the reasons Sharing Kindness exists. And so I am a trained volunteer co-facilitator, and I volunteer as the co-facilitator for the Suicide Loss Survivor Group. So I get to come to your island at monthly. And when we're there, we often take the opportunity to check in with Amanda, with the Community Foundation, with whoever might help us learn more about what the needs are. So we are developing partnerships. We did QPR training for the Boys and Girls Club. We did QPR training at our house. We've really tried to reach out to organizations on your island and develop good relationships. And we will continue to do so.
Great. Thank you.
Sure.
Thank you.
I have a quick
Hand up
question.
too? Okay.
Yeah.
Yes.
So my question is the suicide survivors group continuing, and this would be an add-on to that?
Absolutely. Yep.
Provision?
The
Okay.
Suicide Loss Survivor Group is thriving. We continue to add new folks, and I should have checked. I think registrations are probably up around 13 or 14 right now for that group.
Okay, great. Thank you.
This would be in addition to, yep.
Appreciate that.
All right. Well, thank you very much. Excellent presentation and very good overview. And we will be, this ends, I guess, our interviews. You came in as last, and it's always good to be last, I have to tell you. So we appreciate your time today, and good to see you, Amanda. We'll see you around. And we will be in touch. If we have any further questions, we certainly will reach out for that. But we do appreciate your time and effort today and your application. Thank you.
Thank you. Thank you.
All right. Have a great weekend.
Take good care. Thank you. You also.
Thank you, everyone. Happy New Year.
Right. Happy
Thanks,
New
Amanda.
Year.
So yeah, there is, to my knowledge, nothing quite like the group that they just proposed, and there was nothing quite like the 2 other groups that they started up in the past 2 years. So that was identified as one of the gaps in the gap study, a lack of peer-to-peer or group therapy and counseling resources. And they have been a joy to work with. We probably wouldn't have gotten our QPR program up off the ground without them.
Without them, yeah. Yeah, and my question was, she answered it right away, that this is a sudden death grief support, which is different than PASCON from my understanding, because it's a different level. Some people grieve the same, but it's a different level of crisis and grieving. I know that they've been working with you, Jericho, but I do get excited I see what they're doing in other places, that potentially they can expand and bring some of those other services here to the island also.
I was just like, they're not an unknown, fiscal or grant partner. It's just it was the only point I was trying to make on that.
And I do think that, Joanna, that was an excellent thing, that, to get a anchor here on the island, and with either a board members, and having Amanda is a positive, for their organization. All right. Thank you everyone for plowing through this morning. We
It went
covered a
really well.
lot. It went smoothly. We only were over a little bit, and that was a wonderful thing. We had some back and forth with regard to our deliberations. We cannot meet next Friday, so we are now gonna be doing deliberations on the 31st. And the hope is that we can plow through it in that one day. So drink lots of coffee before you come and, come ready to hash this out, because I think we're gonna have major decisions to make. Sue, I see your hand up.
Yes, my question is, given the discussion with health imperatives about rejigging their ask, I forget how to better phrase it, but amending their ask in light of the money being, the request being for salaries, is that something we want to go back to other organizations that had the same thing?
Joanne, correct me if I'm wrong on this. It wasn't so much, we want them to frame the costs of salary, not as a separate component, but as X, like a percentage, like as part of the program. So there will be, in the program expenditures would be, you know, X number of hours delivering services to Y number of people at Z rate or whatever. It's not, I think that it's operations that are being funded. It's not that it's salary, it's that those salaries need to be a component
Allocated to a program. Yeah, they
Yeah.
have to be. I mean, otherwise we're just not comparing apples to apples. And I do feel like they have to be able to say, like, let's just use the WIC program, for example. If, you know, so she's got nearly 100% participation in the WIC program. What is the cost of the service delivery? Right? Like, for this grant to underwrite the cost of the service delivery of WIC, that's totally a no-brainer, right? It fits in our mission, et cetera. And it stands up when we rank these things across a set of standards. They just didn't break it down like that.
I don't know if they can, because a lot of times people are in there and they're seeking multiple services,
No.
not just one.
Yes, but we're probably making it more complicated than it has to be. I think for them to be able to say, if these are their three broad things and we're looking for a cost of service providing for each of those things, they know the numbers of the people who they're engaging. They just need to divide it by the dollars that they're paying to acquire those services. Right, the exercise doesn't have to do with using multiple services. It has to do with assigning a cost to the service delivery.
It's just, it's a bookkeeping approach that allows us to present these more strongly so that we can, when we do get a needs assessment ironed out, it'll allow us to prioritize them more effectively and then allow us to rank them a little bit more effectively. It won't change what we're doing. And ideally, we'll be doing some education around the next grant cycle. So we'll start having everybody incorporating these kind of operational metrics into their grant application.
Right.
Because we have to pay, like, we won't get services if we don't pay salaries. It's just a question of how we frame that, which makes it more palatable to the budgetary process here, or more easier to explain.
Right.
Understood.
Okay. Jericho, other under business, do you want to mention
Update the
anything?
needs.
Yes.
So, two things that became apparent this week, is that we will likely not get Raftellus to come in and do that coordinated discussion between us and CHS, due to the way that the contract process worked out on that. We'll do it on our own. So I'm thinking we're gonna do in March or April.
Right.
We're gonna have a joint meeting between us and CHS to figure out exactly how we work together and how we inform each other. And then how we can use that to advocate for additional funding in this area. And then the second component, which I mentioned briefly a little while ago, is the needs assessment. That is in the contracting stage. I'm hoping to have the rubric and the evaluation criteria inputted into the procurement software, because that one's going to a full bidding process that will be open to anyone who is signed up for combis, basically. So we're going to be casting a wide net on that. The hope and the bidding process will be configured so that we should hopefully have the beginnings of a report to help us for the next CRC process in this coming fall. But there should not be a final report in time for that, because it should take, they should be collecting data at multiple times in the year and then doing a longer analysis. But we'll have some information to assist us next year with priority setting, and the current process, the current intended bid would wrap up and deliver everything for us ahead of fiscal year 27. So it'd be being done this fall, and we should be getting a report for it, or I'm going to write the criteria for the bid so that we get a full complete report ahead of annual town meeting in the calendar year 26.
Right. Okay. Speaking of rubrics, what we should be doing before the 31st, and actually, if I see Alexandria up there, we should come up with a tally sheet so we can do individual for each organization and then translate that onto a tally sheet that we can then deliver to Alexandria. So we will have that
numbers and
by the 31st. So you'll be getting instructions and whatever via Alexandria, and I'll work with her to get that out, and with a deadline for getting it back to Alexandria. So on the 31st, we could have a summary sheet that we look at.
So we'll have a summary sheet, and then we'll have the number sheet so that we can rank everything.
Right.
And then this year, we need to collect and hold on to the final rubric results, not on an individual basis, but we need to have a collective rank for everything, because that's part of the finances procurement request this year, is to hold on to the metric information, because that is in accordance with mass procurement law.
Right. All right. Any other questions? Jericho, is it premature to talk about additional funding?
So I honestly, I'm
Well, I'm
not
talking
sure
about the opiate.
Oh, so yes, and that's actually, no, thank you very much. So I also received word from Brian in finance that the first tranche of the opioid settlement money that he's gotten in, it was trickling out in small batches, is now collected in one chunk. We're going to be running an abbreviated opioid relief grant process probably in March or April, with an idea to get a single award of $55,000 to one of the to provide services that's qualified. So it'll be a very limited, very short process, but we should be able to turn around and make a grant award of $55K for that meets the opioid remediation settlement requirements. So it'll be a pretty straightforward grant evaluation process.
What are the parameters of that?
So I'll get the exact list on it, but it needs to be spent, the general high level summary of what it needs to go to is it needs to go to, it's opioid remediation. So it's for treatment, prevention, or mediation of impacts for opioid, for opioid. There's an actual handbook and some videos to watch if you guys are interested, but it's more restricted than the grant funds that we usually distribute. So as soon as I get those specific outline of what it can be used for, I'll get that out to you guys. But basically, it'll be an abbreviated grant cycle that we would want to be getting everything together for before the start of the fiscal year in June. And it give us about 2 months to do that whole process. But in terms of people who can apply for it, it's a much more limited pool this year for this particular grant than it is for other things. So we should not have a large number of grant applications.
Do I understand it's just medical?
It's much more direct treatment.
Okay.
That
So that sounds like something that would be suited to addiction solutions.
yes, but given the guidelines that the state had, they want a community involved allocation process rather than a single process, like a single initial grant out or gift process.
Okay.
To my knowledge, there are 3 organizations that are delivering services right now that could fall under that gap. It would be Addiction Solutions, Health Imperative, and then I think NCH in some capacity or another. And then the broader restriction, there's the devil may be in the details on that, because I think it also includes treatment, like counseling treatment and group treatment as well. There's a community.
So then Fairwinds may
yeah.
be there also.
And
Does it have to be one award?
So in this case, I'm saying yes. Brian and I both came to the conclusion that a single award for this is more effective, because we're gonna have it for a couple of years. So we're gonna have it for a couple of years, but this is the most we'll have to distribute at one particular time. The guidelines for the grant or the remediation money were high impact, and a single dose, like a single dose is a bit of an ironic thing, but a single dose initially would be a strong start, and then we're going to have additional monies trickling in the future years, but they'll start to get into the $2,000 to $3,000 per year range.
All right.
So a single large, ideally fungible expenditure would be the best way to spend this.
Okay.
But I will get those guidelines out once I have the particular one we're using for this collection of funds, because it does, I think, vary a little bit from each settlement to settlement.
Okay.
I think that's it.
That's it. So, on the 31st, by the way, the trailer is not available. They're the 29th and the 30th or 31st. They're doing something here. So we are going to be meeting in person at the police and
The training room. It's going to be the police station side upstairs.
So
PRF, I think, PCR, I can't remember what they call them.
So it's above where the select board meets and that big, there's a smaller room up there. So that's where we're gonna be meeting. So we'll be on Fairgrounds Road at 9 o'clock on the 31st for deliberation. So if as many people as possible, barring the weather or whatever, if you can come in person, I think it would be helpful. And of course, we'll be doing Zoom, so, but, we'll appreciate the company that day.
Yeah, deliberation tends to go better in person, I found.
Right, if possible, but if, you cannot make it, we certainly have Zoom, but if we could have as many people as possible in person, that would be fine. We were trying to find, rather than doing just Zoom, we searched to find a place that we could meet on that day. So the town has been cooperative, allowing us to be in that room. So thank you. So you'll be getting something. Alexandria, I'll work with you. I'll wait until Monday. Well, Monday's a holiday, right? Tuesday. I'll be in touch with you on Tuesday. Well, next week. I think you're out a couple of days.
Yes, I'm out until Wednesday. I'm out Wednesday as well, so Thursday.
Okay.
But there's a
so,
CHS meeting.
As long as we'll work on this, I'll work on it with Jericho, and if we could get that distributed, say by Friday afternoon, that would be great, so people have a few days to get that back, and then you would just be tallying all of the results into one document, so we'll give you enough time to do that, all right?
Okay.
Thank you. Any other questions?
Just to confirm, so it's 9 o'clock on the 31st?
That's right.
Okay, I just have to put it in my calendar.
Okay, and we will be at Fairground Road upstairs.
That room I know.
Okay.
Question, can you send the rubric that we're supposed to fill out again, just so that I have it at the top of my email?
Yes.
Yes.
Okay.
All right.
Okay.
Very good. Thank you, everyone.
I have
Long
to
meeting.
hop off.
All right.
I'd make a
so
motion to adjourn.
Yes.
Thank you. Second? All right.
Second.
Joanna,
Aye. And goodbye.
John,
Bye.
Linda? Well, we're waiting for Linda, Sue,
Aye.
and Linda. Motion to adjourn. Oh, you got it from me.
I think we're gonna, I
Okay,
think the measure
you got-
passes. The motion
Got
passes.
it from me.
Four of
so-
us said aye. It worked.
Yes, 1, 2, 3, 4. We got 4 ayes, so we're gonna take that, and Linda may be off somewhere at the moment. So thank you very much. Have a great weekend. Happy Martin Luther King, and other activities that'll happen on Monday. So let's hold our breath. All right.
Bye, everyone.